Hey, what's going on, guys? Welcome back to the Jeremy Scott Fitness Podcast and Radio Show, coming to you on this Sunday, September 21st, 2025. Hopefully it finds you staying safe and staying sweaty all at the same time. On today's episode, we are rapping with Dr. Ashu Goyle. Does that sound perfect?
Yeah, that sounds great.
Boom.
Yeah.
Before we harass him, a couple quick housekeeping things. One, you guys know the drill. JeremyScottFitness.app is live as always. You guys get a free week on me, all my weekly workouts in there. We are loading our 50 days of fitness coming up here. I don't even know what is going on in my life, but we're loading it sometime soon. I would say early November. We're just wrapping up with that stuff. We did put in the Ultimate Total Fat Loss Trainer from BJ Gaddour inside of that bad boy. That is 60 legit unique workouts in there spread out, I believe, over 120 days. So again, if you guys want to pick it up, hop in the app. You guys grab it for me for a week for free. And all my weekly stuff is loaded every Sunday. We'll probably pump that in there in the next couple hours here if you're listening somewhat in real time. Otherwise, JeremyScottFitness.app. You guys grab a week on me for free. And then big shout out to my friends at AG1. You guys know the one thing I take every single day and I never miss. If you guys struggle to eat enough fruits and vegetables, and let's be real, all of us do, this would be the one thing I would take. So instead of taking 18 different pills a day, just take a simple travel pack, rip it, throw it in some water, slam it, and you guys are good to go. Now, obviously, you can't eat like a trash can. You got to still eat real food as much as possible. This just helps cover the gaps in what you are missing. So if you guys want to try it 100% for free, hit me up. I don't care where you live. We'll have Monica send you some free sample packs right to your front door. And if you guys dig it, we'll hook you up with a year's supply of free vitamin D3 and K2 and 5 free travel packs with order 1. And recently, they just came out with a sleep product called AGZ. We have a ton of it here in-house. So if you're somebody who sleeps like a bag of shit, or I don't know, you got a newborn kid at home, whatever it may be, one or the other, we can hook you guys up with free samples of that. I think we have, if I'm not mistaken, the chocolate mint here in-house. That's the only one that I've tried. I like how it tastes. I generally sleep pretty well, although obviously having a little kid at home, not the greatest as of late, but it's getting better. So if you guys want to try either one of those, hit me up for the free samples. Otherwise, drinkag1.com/Jeremy Scott hooks you up with all the free stuff today. All the other sponsors in the show notes. We got stuff to do. See them below. So welcome, my man. Thank you for being here.
Thanks for having me. It's an honor.
Yeah. So let's fuck it. Let's roll. Origin story. We can go as far back as you want to go to. How you got here.
Okay.
Today.
That's a story. I'll try to give a Cliff's Notes version, but so I grew up in southeastern Ohio, a small town called Marietta. It's right in the foothills of the Appalachians. My backyard was Wayne National Forest. So I grew up running through those woods, hiking. So fitness and activity has always been a part of my life. My childhood best friend had 2 older brothers who were wrestlers, weightlifters, and around 5th or 6th grade, I started getting into weightlifting. Push-ups, sit-ups, and then dumbbells. Just kind of started building my body, kind of emulating my best friend's older brothers because they were working out all the time. I was like, oh, that's cool. I want to build some muscle and be cool and grow up to be a man someday.
Yeah.
So I started doing that. Parents got me into tennis because that's what you did when in my little town you started playing tennis. I didn't really resonate with tennis. So when I got to junior high school, I started wrestling. I was like, that's more my vibe. So started wrestling, lifting weights, building armor, got really good at wrestling, did that for a couple of years. Then I discovered music. Music took me out of wrestling and out of sports, but really got me still just focused on what's really helping me become myself, which was music and then eventually medicine. So I started building muscles, getting healthy, playing music, focusing on school, got me to college. In college, continued music, continued fitness, focused on biology and really understanding the body and how it works, got hardcore into yoga, and that's where I discovered the healing power of the body. Movement, mindset, breath work really taught me that we have this innate ability to heal ourselves, right? And so I was really physically fit, healthy, all through college. Eventually got to med school. I chose to go to DO school. So that's, for those of you who don't know, it's Doctor of Osteopathic Medicine. So it's very similar to MD school. The only difference is we look at the body as a whole machine able to heal itself, structure and function. So we focused on the body as a whole and how movement can create energy and space in our body to allow for healing. So we incorporated those principles and philosophies into medicine, and eventually that got me into an anesthesia residency at Cleveland Clinic, eventually into a pain fellowship at the Cleveland Clinic. And then for the next 10 years, I practiced pain medicine at a very high level. I learned how to mask symptoms really, really well. Steroid shots, ablation, spinal cord stimulators, medications. So from 2007 to 2017, I was functioning as a very high level pain physician, but not really truly helping people is what I realized. In 2017, I went to a pain conference. The first day was dedicated to regenerative medicine. Now, I'd never heard of regenerative medicine, knew nothing about it, heard of stem cells, things like that, but didn't really know how to apply it to what I was doing.
Yeah.
So this whole pre-conference symposium was focused on using the body's own innate healing intelligence. So they told us a story about Kobe Bryant, who flew to Germany to get this magic sauce put in his knee that cured his knee pain. So he had an injury that almost took him out of the game, almost ended his career early. Flew to Germany, got this stuff put into his knee. I found out at this conference that came from his own body. And it's just using the body's own natural healing abilities, concentrating them and putting those back into areas that are injured to allow healing, and not only pain relief and inflammation, but also true healing. And that changed my world. I was like, oh, wow. So the stuff I've been doing for 10 years, training with the best of the best, is not really helping people. It is symptom management, and there's something to be said about that.
For sure. Like if you're, obviously my wife just had a kid, they eventually come in and do like an epidural.
Exactly.
And now you can do that raw dog, I guess.
You could.
It seems.
But why?
It would be, yeah, you know what I mean?
Yeah.
So I'm like, in that instance, I'm like, and again, obviously that's how we used to play back in the old days.
Yeah.
But it seems fucking awful.
Exactly.
Or like when you go like in to get like a dental procedure, I'm sure they could just do it raw.
Oh, yeah.
I'd rather not.
Exactly.
So like there is a benefit to it, obviously.
Well, that's the beauty of anesthesia,
Yeah.
right? And so I practiced anesthesia for several years of my career, and then I just took that into pain management, right? But it was all about symptom management. It wasn't really about truly helping people overcome whatever issue it was that got them there in the first place. Yeah, sure, they were doing physical therapy, working with personal trainers, trying to get physically fit, stay healthy, but really the underlying cause wasn't being addressed, which is like micro instability in the ligaments, that repetitive trauma that happens. So in 2017, when I was at this conference, we learned that by addressing those issues, the body can actually function more optimally. And we can not only relieve pain and inflammation, heal the spine, heal the joints, but prevent disease, prevent these things from occurring. And so from 2017 to 2021, I plotted my escape from the practice I was in, and I opened Integrated Spine Pain and Wellness here in Scottsdale, Arizona. So now I do holistic pain management. So what that means is I look at the whole body, how all the parts are interrelated. We focus on anti-inflammatory diet, lifestyle, movement, mindset, sleep hygiene, and then using the body's own natural healing abilities to overcome joint pain, tendinitis, tendinopathies, rotator cuff injuries, spine degeneration, sciatic pain.
So like at what point during a school where you're like, you know what, I want to do anesthesia, and is there like a specific reason other than like the money?
Oh yeah, let me tell you about this. So I did my first 2 years of med school. That's traditional med school, classroom based. You do some rotations, but my third and fourth years of med school, that's where you do all the hospital rotations. So we rotate through primary care, family practice, emergency medicine, surgery, then internal medicine in the hospital, ICU, all that stuff, right? As I went through my third year of med school, I was just checking things off the box like, this job sucks. I don't like this. This is horrible. I can't imagine doing this the rest of my life. So I got to my fourth year of med school, and I was like, I don't know what I'm going to do when I grow up. Because so far, everything I've been exposed to, I don't really resonate with.
Yeah.
So then I did my first surgery rotation. This was at Cleveland Clinic, and I saw a vascular surgeon cut open the aorta, right, and save this guy's life from an aneurysm that was about to burst. And I was like, that's cool. All right, this is where I see medicine really shining here. Like, this is something I can get behind. But after that month-long rotation, I realized that these guys are miserable human beings. They're very unhappy with their lives. The surgeon I was rotating with primarily was on his third marriage and just complained about everything, right? And his whole life was just doing surgeries. I'm like, yeah, I don't want to live that way.
Is it like the stress of work?
It's got to be the stress of work. And to function at that high of a level, I mean, it's hard to find balance, you know? It's like when you're one of the best in the world at what you do, I'm sure that having a home life and having people around you that understand that is hard to find.
Well, I always think of that too, where, like, again, I use my current life example. Like, now my kid sleeps better now, but for the first 2 months, you're literally training for, buds. You're trying to pass SEAL training because you can't sleep. It's sleep deprivation. It doesn't really matter. I don't want to say that, in a way, not that it doesn't matter here, but nothing bad's going to happen. If I come in here dragging ass, these guys have been with me for 15 years. It's a system. We're not doing anything overly dangerous. Short of me like crashing on the way here, it's fine. I can kind of gut through a day. I can't show up to a fucking heart surgery dragging ass and sleep. So for them, like I would imagine every stress in your life, like whether it be poor sleep or your wife is annoying or your kids are going crazy, and then you take that with you to a job that already puts you at, you know, like DEFCON 5.
10 out of 10, right?
Yeah, it seems like that'd be and again, to do that for, I don't know, what, 40 years?
Yeah.
Would be
For
tough.
decades of your life.
Certain kind of person for sure.
Definitely. And thank God there are people out there who will dedicate their lives to doing that.
Yeah.
I wasn't one of them.
No.
What I did see was the anesthesiologist behind the curtain talking about their lifestyle, flying airplanes, playing music, which is something I resonated with. So I connected with one of the anesthesiologists at the end of my rotation that day. Said, hey, what's going on back here? Like, oh, well, we do anesthesia. We keep the people alive on the table while the surgeon's cutting them open and killing them. I was like, oh, cool. You guys seem pretty cool and chill. How do I rotate with you guys? Like, oh, I just sign up for an elective. So I did. So I did an elective anesthesia rotation, and I loved it. Loved, you know, the procedures. We're putting in IV lines. We're putting in central lines. We're monitoring people on ventilators and just really taking over their entire physiology while they're having these life-changing procedures done, right?
Yeah.
I love that. One of the anesthesiologists who I shadowed during that rotation happened to be a pain physician. I didn't even know what that was. But he and I connected on a deeper level, just a deep philosophical level. And he's like, come check out my pain clinic. So the next month, I went to the pain clinic. And that's where I was blown away. We were doing epidural, steroid injections, ablations, spinal cord stimulators. But there was one lady, we did an epidural for her back pain. And he's like, okay, go around on the patients and then you can discharge them. So I went patient by patient. And she was sitting in in the gurney, smile on her face. And her husband was holding her hand with tears in his eyes. I'm like, hey, sir, everything went fine. She's doing great. I'm about to discharge her. What's going on? He's like, I just haven't seen her smile for 2 months. I was like, I want to do this job.
Yeah.
And that was it. So that's how I got into pain. So I was at the Cleveland Clinic. I was like, I want to do the best pain fellowship in the country. How do I get there? They're like, well, do the anesthesia residency here, kick ass, do the best you can, and then apply, and maybe you'll get in. So that was my path. So I did the anesthesia residency at Cleveland Clinic, got the pain fellowship there. This was 2006, 2007, finished in 2007, and then started my career.
And so you don't leave it because, I mean, does that work schedule ever start to suck with that too? Because again, we've had a lot of like anesthesia.
Yeah.
There have been a lot of people here. Obviously, I've been doing this for a long time. Where, and again, every practice is different. Every group is different. I'm sure every personality type is different. But we've had them on here where it's like, hey, I was working 1 trillion hours doing this, and I'm doing epidurals, and I can barely keep my eyes open.
Yeah.
Which also seems not probably ideal.
Probably
either.
not ideal,
Yeah. But for some people, I'm sure it's better. Or was yours more, hey, not that we're not helping people, but I want to actually like fix the problem somewhere else, and I can't do it here, and it's more like a system issue than like a personal thing.
Yeah, that's a great question. So my last anesthetic. So back up. 2007, I did a year of private practice in Columbus, Ohio, because I'm from Ohio. That's what I was familiar with. I didn't see the sun from November to April. I was like, I gotta get out of here. This can't be my day in and day out life. So I moved to sunny Arizona in 2008. Summer 2008. I joined Valley Anesthesia and Pain Consultants, which at the time was one of the premier anesthesia groups west of the Mississippi. I joined their pain division, but for the first year I did neuroanesthesia at Barrow Neurological Institute. And there it was mostly just keeping people under anesthesia safe while they're having their surgeries. The neurosurgeons at Barrow started sending me patients. They're like, oh, you're Cleveland Clinic, you do this. I do everything. Said, okay, we want to send you patients. So they started building me a practice basically for that first year. In 2009, I got out of the operating room. So that meant no more overnight call, better hours, because now I'm in a pain clinic.
So your life got way better.
Got way better in 2009, right. And that's kind of the lifestyle I've adopted since then. So 2009 to 2021, I was with Valley Anesthesia. And it was a great group to be a part of, but it was really heavily focused on symptom management, right? Everything we were taught, I trained with 10 of the top pain docs in the world. No one taught me about spine health, about joint preservation, right? There was none of that. It was like, how do we shut the pain signals off? And that's where they shine, which is great. But what I was seeing in my first 10 years of private practice is I could get really good at shutting those pain signals off. But what was happening was over the course of those 5 to 10 years, spines were degenerating. Joints were degenerating, and people were ending up having bigger surgeries than they might have if we would have been doing something more preservative. Yeah.
Oh, no shit.
Yeah, more regenerative. Exactly. And that was my aha moment in 2017. I'm like, whoa. So the ablations I'm doing, so a radiofrequency ablation is a very common procedure to manage back pain, neck pain, mid-back pain. We use electrical energy to basically cauterize tiny nerves in the back. It's very simple, very easy, takes about 15 minutes, and it can shut pain signals off for 6 months up to 2 years. And people can live very comfortably. But the side effect of that is that nerve, it's called the medial branch nerve, it innervates your multifidus muscle, right? And this is one of the main stabilizing muscles of the spine.
Yep.
You shut that nerve supply off, that muscle atrophies. And you can see this on MRI studies. I see people who've had multiple ablations and their multifidus completely turn into fat.
No
I'm like,
shit.
yeah. And so that creates more instability, and it's a source of chronic back pain. And then so people end up getting more ablations, steroid shots. The steroids degrade your tissues, break things down. You get a stimulator, which masks pain temporarily. And sometimes it doesn't control that pain. Then they end up getting this big spine fusion that doesn't work because that was never the issue, right?
So I guess like when people, so if somebody like that, if like that's the issue, like they go in and that's the recommendation, is there like any other behavior mods like those people get? Like, hey, we're going to do this for you, but you also have to do X, Y, and Z. I know, I'm sure there is there in the intention to do that, but it seems like in medicine, it's when you work in the system, it's very hard to do so. Like if you come
really
to,
is.
yeah, hey, I go to like insert whatever it's Banner or wherever you go, let me do this ablation, and oh by the way, good luck. Now you're fine, it doesn't hurt, but we didn't tell you to go to PT or train or do anything else.
Right. That's the majority of the people in the insurance-based model that we see because we have very limited time with those people, right? So in my last practice, I was seeing 25 to 35 people a day. And that's in an 8-hour window. So not a lot of time to spend with each individual person, right?
Fuck, dude. No.
Yeah, no, we're pretty rushed because reimbursements are so low. You make it up with volume, right?
Yeah,
And
it's a business.
it's a business, yeah. At the end of the day, like someone's got to pay for this, right? And the insurance companies aren't doing a very good job of it. So you make it up with volume. And it's hard to counsel people during that short visit, right? I mean, physical therapy is a big part of what I believe in. Personal fitness, all of that is so incredibly important.
Yeah.
And I believe in, we'll get into what I'm doing now, but in that model, it's very hard to really promote it. You can say, I want to make a physical therapy referral. You don't really know if people end up going or they don't get if they're going to get the true value out of it, right?
No, and again, like a lot of times, I know we've talked about this in here many times before, where if the insurance doesn't pay for it, then some people won't do it. So
Exactly.
there's that limitation. And also, I think for you guys, when you're saying that, like, yeah, I would listen, but like, would my dad? Probably not. He'd be like, fuck this. Like,
Exactly.
what is PT? And not to knock PTs. There's some great ones we've had here, but sometimes it's like it's a PT mill. You go in, here's your sheet of paper that was written 10 years ago.
Yeah.
Stick you in the corner with the tech, and
It's not their fault. That's just the system.
and again,
that's, yeah.
business over there.
Exactly. It's the same thing with pain management. It's turned into an injection mill, right?
Yeah.
So so now clients or patients come to a pain clinic. They see a nurse practitioner or PA who's very good at what they do, but the physician is in a room doing 50 shots a day, and that's all they do. And so there's no connection. And I tell people, like, when I do these spine procedures, this is one of the most intimate things a human could do to another human.
Yeah.
Put a needle millimeters away from your spinal cord safely without messing you up, right? That's a very intimate thing. There's a lot of trust there. Like, luckily, I've built a practice where now I've created connection with my clients, right? I spend an hour with each one for a new consult, 30 minutes for follow-up. Like, there's connection there. The majority of my clients get my cell phone number. So we have a relationship because what I'm doing is very, very intimate, right? And there's a lot of trust there, and I honor that trust. But in that model, there's none of that there. You can't do it. It's just a mill. It's volume, volume, volume. And getting back to the physical therapy part of it, right? And even if your insurance does cover physical therapy, I've got clients who come to me and they're like, it's $50 a session. It's a copay. So they're like, I'm paying $150 a week for physical therapy, and I see the physical therapist for 10 minutes. Then I'm seeing an assistant, and then I'm on a bicycle or I'm on a mat doing exercises, and they're waving at me, thumbs up, keep up the good work there, right? And 6 weeks later, they graduate. Oh, you're graduated from physical therapy. They come back to me, and they've got nothing. And it's such a broken system, right? And unfortunately, it's not getting any better. But that's why I left that system, right?
And I ask this of everybody too, because I do talk a lot of shit about it. But other than blowing it up, There is no. I mean, like, and I don't mean that like in
Yeah,
a.
I know what you mean.
Like, I think there's a lot of good pieces from it. If you can find good people in a good, like my primary person, I think she's fucking awesome. She came from a concierge place.
Yeah.
I followed her because I don't need to pay. I think it was like 10 grand a year to be. I'm like, I'm healthy. I don't need that bullshit. And I can do enough. I'm dangerous enough on my own. But I like her. But if I didn't know her, I probably wouldn't have a primary person I'd go to. And I only go there because my wife has the dopest insurance of all time. And like, it works for us. And I say this, like, if your doctor doesn't like lift or train, like, don't go to him. And I don't mean that, you guys. I go, but I kind of do.
Yeah.
But other than that, like, if you didn't melt the whole system down, how would you even start to fix it? Because it's just so big, and it's so with insurance and like in the med device and everything, it is just giant money. And I don't see how you would fix it, because to your point, even if someone like you who like you give a shit, and like, and I think my primary gives a shit, and obviously like if it's me, I stick out to her probably because like she does work out. I'm a workout person. I don't look like a normal 42-year-old guy. And I also like will send follow-up thank you cards and do shit that normal people don't do. But short of that, if I just was a normal dude, there's no fucking way she'd remember me, because she's going to see 30 people a day. And it's not like, for me, if I see 87 people tomorrow, it's the same 87 people I've seen, most of them, for 15 years. Yeah. I know their names, their kids. I know what they can and can't do. If I saw 30 different people every day, it'd be fucking impossible for me to like create any type of workout program, which is super safe and simple, versus medical shit. Yeah. So like, how would you even, other than blowing it up, like you can't really fix it, can you?
Well, I think you nailed a couple of points there. You know, you've created that connection with your clients. They become your family, right? And that's always been very important to me. But going through medical school and going through the system, we're taught to keep that separation. A patient's a patient. They can't be your friend. They can't be someone you connect with. You're there to provide a service and then move on, right? And I've always felt that medicine is so much deeper than that. When it comes to true healing, like, you have to make those connections, right? And it's about really understanding who people are. Like, that's why I like my consults are now an hour. I'm out of insurance, of course. Yeah. You can't do this with an insurance-based practice. I'll back up and tell you a little story real quick. So 2021, I opened up my practice. I was still taking all the insurances, everything. I was running like a semi-concierge practice through insurance. Well, I did that for 2 years. 2023, October, had really smart people come in, look at our financials, eviscerate them in front of a group of people at a mastermind. They're like, your practice is in the ICU. It's on full life support. They're doing chest compressions. If you don't turn this around in 6 months, they're going to take your life insurance policy, your home, your cars, all your assets. I'm like, what do I do? And so here's a model in pain management, and this is what's going on out there. And, you know, it works for some people, but this is how the system is set up. They're like, listen, you get some mid-level practitioners, PAs or MPs, and then you want he or she seeing 30 to 40 people a day, right? You need to be in the room, in your procedure suite, doing procedures, 40 to 50 shots a day, 5 days a week, okay? And if you put people on narcotics, they'll have to give a urine drug screen. And those urine screens reimburse a pretty good dollar. So you want your nurse practitioners and PAs to be incentivized to write prescriptions, collect urine samples, have a lab in your practice so you can bill for the urine. That's where your money is. I'm like, what's plan B? Because there's no way in hell I'm doing that.
That's crazy, bro.
That's crazy. Yeah, this was a real conversation. So what was plan B? Plan B was drop insurance. I'm like, I'll do that. How do I do that?
Oh, yeah.
So I spent the next 6 months learning how to drop insurance, because we're so indoctrinated into this insurance-based medical system, right? If insurance doesn't cover it, it can't be good, right? There's a reason why insurance doesn't cover these things that can actually help your body. Oh, because that's voodoo. There's no science behind it. There's no research behind it, right?
But I feel like it's almost like, it's like I don't want to say the opposite, because it's not true. But when you look at, because we've talked about this a lot in here, like all of it seems like the hardcore, like the most expensive, I guess the shit you can really make money on, and not that you can't make money on these other things, and I'll back that up. But the traditional, if it is, again, like medications are prescription. It's the original prescription model. If you look at birth control, that's why it was created. And again, you can go down that rabbit hole, but it's the truth. Oh, we can get people to take this shit every month. It's the original Netflix subscription. Yeah. Now it's like, if you're going to take these statins, or you're going to take these pain meds, depending on the duration, or sleep medications, which are usually for about 2 weeks, but most people take them for fucking 20 years. Yeah. Well, if you take Lunesta for 20 years, what is customer A worth? But if you look at these other therapeutics where they're not as expensive, like if it is like, let's say testosterone, or if it is some of these peptides, we're not going to approve these. So you can go just give some dude, like, let's say fucking Lunesta or Ambien, which takes him on a fucking mushroom trip to fucking God knows where, but you can't give him a fucking peptide that maybe would help him sleep.
Exactly.
Like, or if you want to, and we talked about this like maybe 2 weeks ago, like to get like even hormone replacement therapy approved, like by insurance, you'd have to have 2 tests below 300 milligrams per deciliter for multiple tests in a row for your general doctor to maybe prescribe you just something off the top, which I'm like, I know the old school would be like, well, the insurance doesn't pay for this. And I go, it's horseshit.
Yeah.
Like, that's the stuff your insurance should pay for. It should push you not to take these other drugs. Like, I'm not, and again, I'm sure there's a great place for certain benzos and different things. I obviously have taken things and I know they do fucking work. I go, but the risk reward is so high with those versus these other things. Like, hey, we can give you antidepressants, right? And those are basically free with your insurance, or you're going to pay $6 for them. But we can't, like, raise your hormone levels or do anything else because that is not covered by insurance. That's a huge problem.
Yeah.
Like, that's what I do look at is like that part is fucked. So I know people from the outside say, well, I'm going to go get a surgery because my insurance pays for it. But that's like the most invasive thing. It's the most permanent thing. I would try all of the things like you guys do way beforehand. Like, than this other thing.
It makes sense. I mean, now, so my whole practice is focused on biologics. So basically, I can take your body's blood, I can spin it, concentrate growth factors, platelets, anti-inflammatory proteins. I can take your stem cells out of the back of your pelvis, concentrate those, put those into different parts of your body, not only reduce pain and inflammation, but ideally help tissues heal, right? And I tell people, like, before you get that knee replacement, look, there's been numerous studies since 1983. Dr. Philippe Pernigoux, he's a orthopedic surgeon in Paris, France. He pioneered bone marrow aspirate concentrate. So taking bone marrow from the back of your pelvis and putting it in really advanced diseased knees, right? He's launched a study that's been going on for the past 40 years and still going on today, where he took a group of people, said, I'm going to enroll you in this study. You need 2 knee replacements, bilateral knee replacements. I'm going to replace one and put bone marrow in the other, okay? Simple shot, just put bone marrow there. If at any point you want to cross over and get your knee replaced, we'll do it. 95% of people not only didn't cross over, but they preferred the bone marrow knee injection over their replaced knee, right?
And these are people who basically they were like, your knees are cooked.
They're cooked.
Yeah.
These are advanced bone-on-bone knee osteoarthritis. Let's see how well bone marrow stem cells can work. And what he found is that people are getting relief from 1 to 5 years, right? And then at the end of those 5 years, when the pain would come back, do you want a knee replacement? No. Can I try the bone marrow again? 95% of those people prefer the bone marrow knee, right? 5% went on to get their second knee replaced. And this study is still going on. He presented this data at the Interventional Orthobiologic Foundation in February here in Scottsdale. And he's like, this study is going to go well beyond me. He's in his 80s now. He's going to eventually pass away. But it's an open-ended study that just keeps on going on. People are constantly getting enrolled. And the numbers have been steady over the last 40 years. So when people say, Goyle, what you're doing is experimental, there's no data to support it, well, that's the insurance-based model. That's what they want you to believe. But if you take a deep dive, not even a deep dive, this study is readily available. And there's hundreds and hundreds of other studies that are available showing the effects of biologics, right?
Yeah.
And how beneficial they can be. But why wouldn't you, before you get that spine fusion, try a biologic treatment? Because what if this could help, right? Or there are some people who just need spine surgery. Like if you have a herniated disc, a slip disc, it's compressing your nerve, you show up with foot drop, guess what? Stem cells ain't going to fix that. Like you need to go get that disc taken off that nerve. But what happens with that microdiscectomy procedure is you cut out a part of the disc. Now you've lost, let's say 20% of the disc.
Yep.
No one is addressing the ligaments. So you have these interspinous ligaments, you have a supraspinous ligaments, intertransverse ligaments that all form a functional unit around there. No one's addressing that. You cut that disc out, now you've got ligamentous instability. So what happens? The forces and dynamics at that level are going to change, and that disc is going to degenerate at an accelerated rate. That creates microtrauma above and below those segments too, right? I'm starting to work with spine surgeons here in the Valley who recognize this, and they're like, hey, I got to do this microdiscectomy. Once they've healed, I'm going to send them to you. I'll augment with biologics. And the goal of the biologics is to really strengthen those ligaments. And again, this is nothing new. We've got 30 years of clinical data from the Centeno Schultz Institute in Brimfield, Colorado, where they've been doing this functional spinal unit approach to the spine with biologics, using your body's own stuff. No additives, no chemicals. It's just your own body's platelets, growth factors, stem cells, anti-inflammatory proteins. And it's all inside of us. It's just a matter of concentrating them and putting them exactly where they need to go in a very methodical approach.
So I'll just do some kind of bullshit scenario here, which will make sense to people who are listening. Like if someone came in and they did say that, hey man, both your knees are trash. Like whether it's, and what is, like when they say bone on bone, just describe it for someone who's listening. Like what does that really mean?
Right. So when anywhere in your body where two bones comes together, you have what's called a joint, right? Between those joints are tissues. There's
Like a cushion.
Cartilage.
Like
Yeah, it's like a cushion. Yeah, it's cartilage. So cartilage is like the cushion. So when we talk about osteoarthritis, this isn't like rheumatoid arthritis. So there's two main types of arthritis: rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is where your body's immune cell recognizes your cartilage as a foreign object and it starts to attack it, saying, "Oh, we need to get rid of that." So over decades, what happens is your immune system attacks that cartilage and breaks it down. With osteoarthritis, it's what we call wear and tear. Normal living, working out, taking care of yourself. Over time, that cushion wears down. When it's bone on bone, there's no cushion left. So the bone is rubbing up against the bone.
And so like when someone comes in, if like that's what the image shows or that's the assessment, what do you guys look at then? If they came to you versus, hey, I went down the street and they said I need a double knee replacement. Mm-hmm. And it maybe, and obviously every scenario is different when you see people, but if you were like, hey, yeah, I think we can help you, what does it look like on your end? Or what would you say to somebody if they're like, yeah, I want to get these knees both replaced, and you look at it and you're like, I think we actually can help you. Like, what does that look like?
That's a great question. So, I mean, the definitive treatment for bone-on-bone knee osteoarthritis is a knee replacement. Not everyone's a candidate, and not everyone wants to do that.
And dude, we've seen them here with people. Yeah. I'm sure there's people where they're great. The best ones I've seen personally, and this is anecdotal, I don't have the fucking, randomized human control trials to back it up. I'm like, but the hips tend to look like they're the easiest. Yeah. People are up walking quickly.
Hips do really well.
They come back here way better. The knees, I've never seen anybody like high level do a knee come back and be similar level. It just seems like, obviously it's stuck between two other joints, and I think, in my opinion, your ankle is the most important joint because if you can't walk, quality of life sucks, and that's basically dorsal flexion, plantar flexion all day. So your knee does take a lot of abuse. But I've never seen anybody get a knee replacement and be amazing. I'm sure there is a lot of them. Yeah. I just haven't seen a ton.
Yeah. No, they are, or else they wouldn't do them. Yeah. A lot of people do really well.
But the amount of rehab,
that's what it is.
It's fucking crazy.
I tell people to give it a year, right? But you have to do the prehab. That's equally as important as the rehab. Like the stronger your quadriceps are going into this, the more functional you are, the better your outcomes are going to be, right? And so I'm starting to work with surgeons who recognize this now, where they're doing high protein diets, getting them on the right supplements, doing the prehab, the physical therapy, the fitness training, all of that before they do their surgery, because there's going to be a period of downtime, right? And usually it's older people who are getting their knees replaced. Yeah. So what that means is when there's downtime, they develop sarcopenia or they lose muscle mass.
Just atrophies like crazy.
Exactly. It atrophies like crazy, right? And that's a longer road to recovery. So the goal is to build it up before you get to that point, right? But getting back to the original question, so if people come to me and they're like, hey, I got bone on bone, I really don't want to do a knee replacement, I'll present them with some of the data that we have for bone marrow stem cells and say, look, we can give this a shot, right? It's minimal risk, right? And the worst case scenario is it doesn't work. Yeah, it's not covered by insurance. You'll be out some money, so I got to make sure it's disposable income for some people, right?
Yeah.
I mean, so when you step outside of insurance,
it's your knees.
But it's an investment in yourself, right?
It's your fucking knees.
Exactly. You're investing in yourself, and with this data that we've got, like what if you could get 1 to 5 years of relief out of this, and then you could focus on the physical therapy. That's a part of my protocol. Like I don't just have people show up and put them on the schedule the next day for these biologics. There's a whole protocol that goes into play, because I tell people when you're considering these biologics, you're the pharmacy that's making the stuff I'm going to be injecting back into your body, so make it good. That's where movement, mindset, sleep hygiene, physical fitness, all of that comes into play. And so I have people do that. Some choose to do it for 2 or 3 months before we'll even get to the biologics, which is amazing. The healthier you are going into this procedure, the better your outcome is going to be.
So like walk me through if, I guess I'll do this question first and then we'll go back. So if you can walk me through like the first kind of assessment appointment when you see somebody, like maybe Joe comes in, both his knees are screwed. Yeah. What does that look like to him? And like, how do you tell him to get ready for like what the next step is if he wants to move forward.
Yeah. So meet Joe. Joe's like, hey, I've got this knee pain. I saw orthopedic surgeons. I've done physical therapy. I've done everything. And it's at the point now where it's affecting my quality of life. I can't play golf anymore. I can't play pickleball. And I'm in a lot of pain. Right. And they're like, I don't want to do a knee replacement. All right. So we'll look at everything. I put them on an anti-inflammatory diet if they're not already on one. I'm blessed right now because a lot of my referring providers are concierge medical physicians who are functional medicine trained as well. So people come to me pretty teed up, right?
There are people who give a shit already.
They do.
Yeah.
Exactly. They're invested in their health. They're going outside of the system
And
to get real health care.
It's Scottsdale.
And it's Scottsdale too.
Let's be real.
Yeah.
I get it.
There's that too, right? So anti-inflammatory diets. So eliminating sugar. I tell people no alcohol a week before, the week of, or week after. That's really important too. Alcohol is a cell killer. So no booze. Smokers, not an option, right? So if Joe's a smoker, I'm not doing this. Vaping, same thing. I was like, if you are a smoker, THC, pot, whatever, tobacco, it's not an option. For my clients who are marijuana users, switch to edibles because it's the carbon monoxide in the cigarette smoke that's in the smoke that's a cell killer, right? So getting back to Joe.
And you're trying to basically like eliminate all of the shit
toxins,
the shit inflammation in the body.
Exactly. Yeah. You want a healthy body. You want healthy cells. You want healthy growth factors, right? So the healthier you are, the better your outcome is going to be.
For sure.
So anti-inflammatory diet. We work on sleep hygiene. I'll put them on appropriate supplements if necessary. I mean, ideally people will get everything they need through food. 99% of us don't.
Yep.
So that's where supplements come into play.
For sure.
And then I also incorporate hyperbaric oxygen therapy. So this is where people go into into a chamber. It's 100% oxygen under pressure. And that has the benefit of, number one, increasing stem cell production in your body, right? It also releases what we call growth factors that can help tissues repair and heal as well. So when you do a few sessions of this before I draw your blood or before I take your bone marrow, we have robust amounts of growth factors and an increased level of cells there that I'm going to use. So let's say he follows that protocol. Usually it's about anywhere from 2 to 4 weeks. That's the bare minimum. Some people choose to follow that protocol a little bit longer. So he's a candidate. He's followed the protocol. He comes in for his procedure. On the procedure day, depending on what we're doing, if it's just PRP, well, for Joe, it's going to be bone marrow stem cells because he's got advanced knee osteoarthritis, and that's where the best evidence is when we're doing these biologics is for bone marrow stem cells.
And how different is that from like the PRP?
Well, PRP has no stem cells, so PRP is just platelets and growth factors. Okay, so your platelets, what they do is they're little packets of proteins, if you will, right? And when you're injured, let's say you cut your finger or cut your wrist, it splits open, it bleeds, right? Eventually it stops bleeding. Well, one of those key factors that stop the bleeding are platelets. You also have this whole other clotting cascade, but we'll focus on the platelets. There's also inflammation that occurs from local damage. That inflammation is actually really good because that inflammation causes the platelets to open up and release these packets of proteins that are what we call growth factors. Those growth factors have a lot of different effects in that tissue. They can summon stem cells to the area, which is one of the main reasons that I like to use platelets in combination with stem cell procedures. But they call stem cells to the area, and the stem cells cause the tissue to replicate, divide, and heal. So,
like Wolverine.
Like Wolverine.
Pretty much.
Yeah.
Well, I think, and I'm like you said that because I think a lot of people, again, in the health and fitness world now, there's just so much information. Everything's a fire hydrant of shit. And everyone's like, oh, this causes inflammation. I'm like, not all inflammation is bad. And I think people hear that. I go, if you had none in your body, you would die.
Right.
Like you literally would drop dead. So there is some like the chronic shit, no.
Right.
But the stuff that's there, like you do need some of it.
Yeah, the acute injuries. Like if someone sprains their ankle, rest, ice, elevation. That's what we were always taught, right?
Yeah.
Right. That's the worst thing you could do.
Yeah, which is crazy.
Which is crazy.
Well, it's the not. I hurt this thing. Let me not move it.
Right.
At all. Which, short of like you have a full tear of something, like it's pretty much never the best scenario.
Exactly. Yeah. Full tears are a different story. I mean, we have to be realistic too. I mean, luckily with bone-on-bone knee osteoarthritis, we've got the data that shows that bone marrow stem cells can be beneficial, right? But if you have a full torn ligament, like I've seen people with full thickness rotator cuff tears. So the rotator cuff as part of your shoulder.
Yep.
One of the tendons is ripped off completely. Like I tell people, this isn't going to magically make that tendon crawl back to your humerus and reattach. Like that's not going to happen. It can help with pain and inflammation. So if you're not a surgical candidate, you can consider biologics for some long-term pain relief and that kind of thing.
What if it's not the main, like obviously your ACL, you're smoked. What if it's something else? Like you have like a small meniscus tear that you're still cooked?
Yeah, no,
Surgery?
no, not necessarily.
Okay.
Yeah, but if it's a displaced flap tear, it's mechanical and clicking and catching. Well, that's a different story.
Yeah.
Ideally, we'll want a surgeon who can just sew it down and just repair it instead of cutting it out. Right?
Yep.
Because a meniscectomy, which is where an orthopedic surgeon goes in, they cut out the meniscus. It doesn't grow back. And so I tell people that's one step closer to a knee replacement because you've lost the cartilage or the cushion in your knee permanently, right? So some are surgical, but some aren't, and so
Interesting.
yeah, it just depends on what the mechanics of the injury are and how it's presenting.
So if the guy comes in and it's like, hey, you're going to actually inject him, like what does it look like? It's like either there for a couple of weeks you go through? Like how does that?
Great question. Yeah. So I do have people who've flown in from all over the world to see me for these procedures. And so if they're coming from out of town, they'll usually fly in the weekend before. I'll meet them on Monday to do I'll usually have done a Zoom consult 1 or 2 months before they actually come in, or even a few weeks before they come in. So they'll get all teed up in their hometown or wherever they're flying in from. I'll fly in the weekend before. I'll see them on Monday, and then the procedure's usually like, let's say, a Wednesday, right? So for my out-of-towners, I'll see them on Wednesday. They're here for the week. Do the procedure on Wednesday. They're fine to fly on that following Saturday. For my in-towners, I'll see them for the consult. We stay in communication via cell phone, email. I monitor their progress, communicate with their personal trainers, with their physical therapists, their chiropractors, and make sure that we're heading in the right direction, right? And for some of these people, it can be a couple of months. For some people, it's a couple of weeks. They show up for the procedure, right? So on the day of the procedure, I do most of my procedures under sedation because I'm an anesthesiologist. I want people to be very, very comfortable because why not? These procedures can be very uncomfortable. When we inject PRP, when we inject bone marrow stem cells, it's a lot of pressure. I've had it done to me 4 times in my left knee. And every time it's been done, it's pass-out level pain.
No shit.
Oh, yeah. And I tell people...
Because what is it, one injection, multiple?
It depends. So usually it's more than one.
What are we talking here? Like it's like legit?
Yeah, it's legit. Yeah. It depends on what joint it is, right?
Yeah, yeah.
Obviously, if I'm doing a thumb joint, it's a tiny syringe, it's a little volume, but that's a little space. It still feels like your thumb's going to pop off your hand there.
For sure.
Yeah, it's pretty intense. So like when I've had mine done, it feels like my kneecap's going to pop off.
No
like
shit.
I feel like I'm giving birth out of my kneecap every time. I'm like, oh man, I feel like I'm giving birth out of my knee. But it's that intense. It goes away, right?
For sure.
So I want my clients, look, they're paying for this. I want them to have just a concierge level experience throughout the entire process. So they're not in a lineup of a mill of injections. It's usually just one person, and they're the only ones there. They can bring their family members back to the pre and post area, bring them back to the procedure suite. We'll work in the sedation after I'm done processing all the biologics. I do all the processing myself. I get mad scientists with all that stuff.
And that's like in real time, right?
Real time.
Yeah.
Yep. So they'll check.
Because those only last, they're not good for like, it's not like you can pull out shit and it's like, oh, let it sit on the counter for 3 days.
No, it's got to go right back in.
Okay.
Yep, exactly. So I'd say from actually drawing the bone marrow stem cells of the blood to re-injecting is about 45 minutes tops.
Okay.
45 minutes to an hour.
Nice.
Yeah, and that's all based on my processing time. And we know that during that time, those bone marrow stem cells are still alive. So, and that's really critical. Like, a lot of people are getting stem cell injections here in the Valley, off-the-shelf stem cells. They're 100% dead.
And so and that's what I wanted to ask you too, because I think when you say the other, like everything else, and I'm generalizing here, maybe you guys listening know everything. Because like my mom will listen to this, she's like, what the fuck is this guy talking about? Because everybody knows stem cells. They'll say it. And a lot of people will know, it's kind of like in training, like what an AMRAMP is or like what PRP is. You can say it, but we're just parroting. We don't know what the fuck we're talking about. Stem cells, I feel like a lot of people say they do that. But I also feel like a lot of it is bullshit. Yeah. And maybe this because I don't trust anybody, not the government, not any people, nobody. So explain that to people who are listening. The version of, hey, we just pulled this from you, we're going to spin it, do our wizardry and then put it back in you versus, hey, I go to this clinic and they give me stem cells, but they never took my own blood. Right. Like, are those things worthless or is there some benefit to that?
They're pretty much worthless.
Okay. Yeah. That's what I wanted to say that, but I didn't know.
Yeah, the cells are dead. So basically the docs who are doing this are getting sold these products by a representative for the company who is just basically a marketer. So they're like, here, buy these products, right?
Because they're not that person's blood?
No, they're coming from umbilical cords, placental tissue.
Oh, yeah.
So
Like,
that's where they get them from, right?
like cord blood and shit like that?
Cord blood and stuff. Yeah, exactly. But we have no idea what is actually in the vial that you're buying, right?
So fuck it. Inject it.
Inject it. Yeah, right.
It's like doing steroids 30 years ago.
Exactly.
Your buddy gave it to
And
you.
people are still doing that. And they're doing that with peptides now, too, because the FDA banned peptides. So now people are going to this gray market area to get peptides. And
Like not from a pharmacy?
not from a pharmacy. Yeah. Yeah. Some of these are for research purposes only. And the concern there is that they may not be pure. And so you could be injecting an impure product into your body that maybe in a year is going to cause an autoimmune disorder or some kind of reaction. We just don't know. And that's why on the bottle it'll say for research or animal use only.
I have some.
And that's incredibly important for people to realize, right? There are some companies out there that say, no, this is human grade. We just can't say that it is because the FDA, but we still don't know. Like without that certificate of analysis, and same thing with stem cells. If people are getting this, first of all, there's no off-the-shelf stem cells that you can buy. The cells are dead.
That's what I want. I mean, that's the thing I think people want to hear. And I'm going to ask about the peptides too. Well, people are going to I'm going to jump all over the place just because
it's okay.
That is the off-the-shelf stem cell shit, bullshit.
Yeah.
I don't know enough about the oral peptides either because I'll have people here who ask me. The only ones that we've ever had people are from physicians that come from the compound pharmacies, but they do change a lot because the FDA does fuck with them. So people will be like, I got BPC 157. I'm like, no. Like maybe you got pentadeca arginate, which is comparable, but they're not this. They are the same thing, but they're not. I go, so that's, I guess, when I ask, that's what I'm always curious about. I'm like, what pharmacy did you get it from? Is it a real place? And I do think that is bullshit because then you do have people buying, it's like buying fucking gear off the street.
Yeah.
You're just taking fucking nonsense. Right. So it was interesting to me that I mean, I guess I'll ask this too. Like your take on peptides, like if you can get real ones.
Yeah.
Like there's a benefit.
Oh,
obviously.
I'm a big fan of peptides. Yeah. Absolutely. Yeah. I mean, it just stimulates our body's natural production of whatever we need to heal.
Yeah.
And I will get better. Yeah.
And we've used them for healing purposes too. Yeah. Like at the time when you could get BPC 157, TB 500, I would take. Yeah. For me.
Oh, yeah.
And my disc issues, like I've never had surgery. I feel perfect. I do all the same dumb shit I ever did, even in my 40s.
Right on.
Which is great. I can't say it's just that, but I do think, and that's, I guess I'll get your take too. A lot of these things, whether it be if your hormones are regulated or if it is even like the other peptides like CJC or Semerelin and things like that, the healing part of it, I don't know enough, but I feel like anything that makes your sleep quality deeper and better, that has to be just, maybe there's other factors that are involved in it, but people are like, I recover better. I'm like, well, if you slept better, you're probably recovering faster. Exactly. Your body's healing faster. It's doing what it has to do.
Right.
Interesting.
Yeah. I can't stress the importance of sleep hygiene. I mean, that's probably the most important thing we could do for our overall health and well-being is get adequate deep sleep.
So do you guys ever do like say, hey, if someone like went through your protocol, they did those stuff, do you have a person you refer to for like if it is peptide stuff, or you just say, hey, here's our other options too. Hey, you've been doing this. Here's the, obviously everybody calls it the Wolverine stack. Yep. I mean, that's probably the most popular one. Yeah. Is that what you guys do sometimes?
Yeah. So I'm blessed to have connected with some of the most incredible providers in the Valley. Physical therapists, chiropractors, naturopaths, internal medicine docs, family physicians, all of whom have the same philosophy on healthcare and really helping people heal. And so depending on what people need, I'll send them to the appropriate place, right? And some people are experts in peptides, so I'll send them to this person for the peptides, right?
Nice.
But the problem is right now we're limited with what peptides we can get a hold of. That's all going to change after October 31st. There's a company that just sued the FDA, won a lawsuit against them to bring many of the banned peptides back onto the market. So I think by the end of the year, we're going to see a lot of those peptides come back.
And again, like for people listening, I just think regardless of where your stance is on doing certain things or not, I'm like, just the fact that you can get the real shit and not have to do this nonsense. Because I have people here, same thing where I'm like, well, did your doctor give it to you? They're like, nah, I ordered it off the internet.
Yeah, I got to be careful.
That seems again, like I've never wanted any, like if you told me it would make me like prime Michael Jordan, sure, dude, I'd probably fucking take, you know what I mean? But short of that, like.
But at what cost though? What if it's taking a year off your life or 2 years off your life or causing a problem down 5 years from now that you don't know about?
Yeah. I mean, if it's prime Jordan, I'd probably make it work. Right. But no, like that's my point is unless it's going to do this, like unrealistic thing, there's no way I would do that.
Yeah.
Because I don't trust the place it's coming from.
Same.
Because you don't, again, obviously, like the long-term effects of any of these things, I think you should have somebody guide you. But that is weird that you said, like, obviously, if it's not approved for, or whatever it is, it's not human use, but
Yeah.
it's,
Research use only,
Yeah.
or animal use.
which is fucking bonkers.
Yeah.
So when they come back to you guys and they do get the injection, it's one and done?
Yeah, so typically, yeah. So it just depends on what it is. So with PRP, it's usually I'll do one procedure, we'll reevaluate at 6 months. Bone marrow, same thing. Now there's another procedure I do. It's actually a program called the Regenerative program. So this is what the athletes fly to Germany to have done, right? So a lot of these athletes, even right now, they're still flying to Germany to see Dr. Peter Veiling, who's a molecular biologist and also an orthopedic surgeon, who basically found a way to take your blood and process a serum directly from your blood. No additives, no chemicals. It's less than minimally manipulated. You take it and you process it according to his protocol, and it's full of an anti-inflammatory protein called interleukin-1 receptor antagonist, so IL-1RA. I tell people, think of this as your body's natural cortisone. It's as powerful as cortisone, but not destructive. None of the side effects. This is coming from you. But it's also full of your own peptides. So believe it or not, our body makes its own peptides, right? So
Well, because the peptides are just amino acids pulled out, synthesized, essentially.
exactly.
Yeah.
Yep, exactly. So with this is your body's own natural peptides. People have heard of exosomes. People are buying exosomes now. It's still kind of a gray area. Some people have amazing responses to these off-the-shelf exosomes. Well, with this Regenerative program, I concentrate your serum and also the exosomes that are naturally within your body. The benefit of this is I can safely inject it in areas that you normally wouldn't take something off the shelf and put in your body. With this, it's your own natural exosomes, it's your natural anti-inflammatory cortisone, it's growth factors, and it's your natural peptides. I can put this in the spine, just like I would do an epidural injection with steroids. I can inject this around the nerve root, where the disc is, the ligaments, and knees. That is a series of 4 to 6 injections. So with the PRP, bone marrow stem cells, it's usually one and done,
Okay.
right? But it can be multiple shots in that one sitting. So let's say you're coming in for a procedure tomorrow, Jeremy, and we're going to do your spine. That might be 30 or 40 sites that I actually inject if we're doing bone marrow or PRP.
Oh, no shit.
But but then we're done. It's all shots. It's no needles. Most people say they're sore and achy afterwards. No real pain. And that soreness and achiness lasts for anywhere from 3 to 5 days, right? With this procedure, usually targeting one or two spots, and it's a series of injections. No downtime. You don't need sedation for it unless you want it. But I can go in, I can put this serum wherever the problem is, and we do that over the course of anywhere from 2 to 6 weeks. What's nice about this is we can actually save the serum. And so let's say someone's flying in from out of town. They're only available 2 days. I can do their 2 shots that week. They can go back out of town, fly back 4 weeks later. We can do another 2 shots. They can fly back and come back in a month later and do another 2 shots. That's the beautiful thing about this Regenerative program.
And what is, like, who's a candidate for this? Or, like, what do you treat? Is it the same stuff you treat with?
Great question. The benefit of the Regenerative program is there's no downtime. That's why all the athletes are having it done.
Because they want to, like, keep doing shit.
Return to play is the next day, man. Yeah. So let's say you come in, you're like, Goyle, hey, listen, I got this knee injury or whatever it is, right? A shoulder. And look, I got to keep on training. I can't stop. With PRP or bone marrow, there's about a week downtime. I'm like, you're not lifting that part of your body. You're not going to exercise it for about a week. And then you're going to get into a physical therapy program and rehab it over the next 4 to 6 weeks. So
versus like Jack and Steel again or playing sports.
Exactly. With this, literally, I can do your shot tomorrow. You can get back in the gym the next day. You're only limited by the pain you had before the procedure. So that's the appeal for this. So if I got golfers who are like, I got a golf tournament, like I can't take the downtime to do the PRP or bone marrow.
Time is money, yeah.
Exactly. They're like, hey, I've already paid for these. I got 6 trips coming up. Regenerative would be a great option for them. Yeah. And we still incorporate all the other stuff, anti-inflammatory diet, sleep hygiene, supplements, physical fitness, personal training, all that stuff, physical therapy, chiropractic, all the modalities. So it's a whole program they're in. The injections are just one part of that whole program. We also incorporate MLS lasers. We have a class 4 high-powered laser, uses 2 different wavelengths of light to get deep into tissues. One stimulates cellular repair, tissue healing. The other wavelength of light has an anti-inflammatory effect, so it can relieve pain and inflammation. So we augment these biologics with this laser. All no side effects, non-invasive, but it augments the whole healing process so people can get back to play sooner rather than later.
And like in terms of like spine stuff, like what do you guys see most often, or what's the ones you, I guess, treat the most?
Yeah, great question. So I trained at Cleveland Clinic, like I said, with 10 of the best pain docs in the world, and it was all spine. I mean, I've done tens of thousands of spine procedures in my career now. I'm seeing everything from herniated discs, so slip discs for clients who might understand that better. So if you
Yeah.
slip a disc and you get shooting pain down your leg or shooting pain down your arm, I see a lot of that. I see people who have chronic degenerative wear and tear that happens over time. They're like, look, I just got an aching back. I wake up every morning. My back's killing me. It takes a couple of hours to get my day started. I'm good for a few hours. I go play golf, and then my back's flared up again. And that's like an everyday routine, right? And we get an MRI, we just see degenerative changes, right? So I see a lot of that as well. And these biologics can really shine there because the only traditional options are steroid shots or ablations, all destructive, right?
And I'll ask that too, since you said it, like the cortisone stuff, like what does that do? Because that's probably the most common thing. Like we'll get people here who are addicted to fitness and exercise.
Yeah.
Oh, my shoulder hurts, insert whatever the problem is. It could be
Yeah.
7 different things. They'll go to PT, they'll do it, but then obviously they don't listen. And even in then, I don't think PT is going to fix it. They'll beat the shit out of themselves. And it's like, I got a cortisone shot and now it feels fine.
Right.
It feels like, they'd be like, if you're like, that's like some disease, right? Where you're like fucking kid who like cuts themselves and they don't know it. You know what I'm saying? Like, well, you can just like, put, like, it sounds cool in theory. Like you could ride the assault bike and you're in so much pain, but you don't give a fuck. Like it's cool, but it's also like you break your foot, you don't know it.
Yeah.
I feel like cortisone does that. Like it's already damaged.
Yeah.
We're not really fixing it. So now we can keep lifting heavy as fuck
Right.
on the same joint and the same ligaments. What does that cortisone do to you long term?
That's a great question. So what people don't really talk about or realize is that, yeah, cortisone can be profoundly anti-inflammatory and relieve that pain that you're feeling, right? But it's also incredibly toxic to the tissues. When you inject it in the shoulder, if it's a rotator cuff tear, you're weakening the tendons that hold that muscle to the bone, and you're making your condition worse long term. And what's going to happen is you're not going to have the integrity, the structural integrity of that tendon, and it can snap. And then you're looking at a really, really big surgery. When you put it inside a joint, it eats away the cartilage. It's what we call chondrotoxic, which means it kills the cartilage cells. You may feel great, but you're one step closer to a joint replacement that's irreversible. Because right now, there are very few. There's some studies that are showing that we can eventually regrow cartilage, but we're not there yet. So,
Like, and how many, so your general, is that like your general doctor does that?
general doctor, a lot of orthopedic surgeons.
So you just go in and how many will they give you? As many as you want?
I don't know. It just depends on who the physician is. Like I've seen some people who have like more advanced knee osteoarthritis, and they go in every 3 months and just get their joints injected. And it's not only. So here's the thing.
Does it work like when you do like drugs? Like it's less effective over time?
Well,
Like you snort a little bit of cocaine and then eventually you're like Scarface and you're like, fuck it. You know what I mean?
Well, I think the way it works is that the more injections you have, the more damage it's causing. So the disease gets worse, and then the drug becomes less effective.
That makes sense.
So that's what's happening. It's not like you build a resistance.
Your
to the
knee's
drug.
just more fucked.
It's just exactly that's what's going on. Yeah,
Okay.
you've just broken down the cartilage to a point where now it's just not effective, right? And so ideally, I want to see people before then. So my goal is prevention. Like I want to see healthy, active people before they're broken. Because, like I said, what's more anti-aging than preventing wear and tear of your body, of your joints, of your spine? These biologics, they've been shown. I mean, we have a number of studies, especially in the knee, that if you put the right dose of PRP and platelets inside the knee, it prevents the breakdown of cartilage. You will have no cartilage volume loss. This is reproducible. You can do MRIs before and after, compared to saline, compared to cortisone. The PRP group outshines them all. And this is level 1 evidence. I mean, randomized controlled trials. There's been a couple of hundred over the last couple of years from all over the world. And I tell, like, again, what's more anti-aging than preventing wear and tear of your joints in your body?
Well, and I guess that's my last question on that. Like, they do cortisone shots in your spine too.
Yeah, that's the standard of care.
So it murks your spine then eventually, like the discs.
It does.
Jesus, dude, that would be
the discs, the nerves, but it can also repeated injections, especially with a certain type of steroid, can cause what's called arachnoiditis, which is an inflammation of the tissues around the spinal cord and the nerve. And that's a debilitating pain. It can happen with just one shot. So there's actually a case in the community that I became aware of a very prominent person, very physically fit, active, who went in to get a routine epidural steroid injection for her back and leg pain, and then 2 weeks later developed debilitating pain. turned into arachnoiditis, and now she's debilitated. Like her whole life is gone because of this one steroid injection. And it's really, really sad. But that's a risk, right? So I tell people, I mean, it's what's covered by insurance. It's
But
the
the
standard
spine,
of care.
dude, like
but
the spine to fuck with, man, is like that's because I've had like I've never knock on wood, I've never broke anything other than fingers.
Well, that's why you want a double board certified, fellowship trained person doing your spine injections, right?
So, and I was going to ask that too. Like when people see that, they don't know what the fuck that means. And so
Yeah.
I like you to explain it just because this is the example I always give. I think most school is bullshit. Obviously, like if you're in the machine, lawyer, doctor, whatever.
Yeah.
I went to college. Who gives a shit, dude? Cheated a lot. Really good grades. Graduated cum laude. Who cares? I go, but when I go places, like I'll look up stuff. Now, it doesn't mean that you're great. So I've been to places where the doctor sucked ass and he went to Cornell. You know, and I'm like, whatever. But he was a bum. But most places, like I don't look and say like on the wall, where did you graduate? Like I don't give a shit. I go, but I know the fellowships do matter 100%.
Yeah.
And double board certified. Like Amy Shaw was on here.
Yeah.
Like she
Love
spits
Amy.
it. She
She's
spits it.
incredible.
I think every time she does her intro, she says it too. So for people listening, explain those two things just so they know what to look for when they look at a physician.
Yeah, so board certification, that's incredibly important. Let's start with that. So when we go through our medical school training, then we do a residency program, whatever specialty that's in, there's a governing body that makes sure that we've met the minimum requirements to be specialized in that field and to provide that service safely, right? That's board certification, and it's rather rigorous. At least in anesthesia, it's a written exam as well as an oral board exam. And with the oral board exam, I can tell you that was probably so when I got my anesthesia board certification, that was like the biggest accomplishment for me. Like graduating med school, okay, you know, getting into residency at Cleveland Clinic was pretty awesome, and also the pain fellowship. But getting my board certification, that was really a milestone event in my life.
Because it's hard.
Dude, you have to know everything. Literally, you're at a hotel room, at a hotel, you walk into a room, there's two anesthesiologists, and you have it on. Actually, before you walk in the room, there's a sheet of paper. It's got one case. It's like, okay, 45-year-old gentleman, history of high blood pressure, diabetes, is coming in for a knee replacement, right? And here are labs, here's some medications. What's your anesthetic plan, right? So you think about that. You go in. They can ask you anything related to the world or field of anesthesiology, physiology, pharmacology, anything at all. You have to know everything. And you don't know where they're going to take you down this path when you start the case, whether they're going to take you down to the road, okay, now this guy's like flatlined, what are you going to do? Like you could go anywhere.
They're trying to weed out the shit.
Like are you worthy of being board certified or not, right?
For sure.
So that's what board certification is. So the fellowship training means that you've done additional training in whatever subspecialty that you're practicing in, right? And that's incredibly important as well. Like I said, I trained at Cleveland Clinic, did anesthesia, then also did my interventional spine and pain fellowship there. But it was heavily interventional. Like we learned to put a needle everywhere in the spine safely without hurting people, right? We got 10 of the top docs in the world who've done hundreds of thousands of these procedures. Like you want someone who's had that kind of experience because the spine is such a delicate, critical structure. Things can go wrong. And it's like even in the most skilled hands, something can go wrong. But you want the physician who's going to recognize that complication and treat it immediately before you're seriously messed up. Like and that's where the fellowship training comes in and the board certification.
The take is there's doctors out there who are not this.
Yeah, there are people who are doing weekend courses and then coming back and practicing, right?
In your spine.
In your spine, yeah. And there's people who...
I mean, not that it's better in the knee or the shoulder, but it's probably...
It's a little less forgiving.
It's not as catastrophic.
Yeah, it's not as catastrophic.
You're fucking... Dude, when you have back pain, you're fucked.
And let's get into this, too. So a friend, an orthopedic spine surgeon in town who's a good buddy of mine, sent me a social media post on a guy who's doing PRP in someone's shoulder, right? And so he had the PRP syringe, and he's just he's feeling it and poking around and doing like 4 or 5 shots. No image guidance. So literally putting the needle in and squirting it in there. So I tell people, once that needle is under the skin, you have no idea where the tip of that needle is. You might have a general idea, but you can't 100% guarantee it.
No.
right? So what we're talking about is image guidance. You need either fluoroscopy, which is a big x-ray machine, especially when you're doing spine. If you're getting a spine procedure done and there's not a big x-ray machine in the room that's with an x-ray technologist running it, run, because you're not getting a true spine procedure,
Do you
right?
think that happens a lot?
Oh, I know it does. I know it does.
Like even here?
Even here, yeah, they're doing it under ultrasound, which is fine. You can do prolotherapy. You can get the superficial structures, but you can't go deep in the spine without an X-ray machine. You have to. You have to inject contrast to make sure you know where the needle is, you know where the medication or the PRP or whatever you're injecting is going to spread.
Yeah.
Incredibly important. Same thing with the shoulder. Yeah, you're not going to really screw anyone up if you just put the needle in there. And I'm sure orthopedic surgeons will tell you, I know exactly where I am. I guarantee you put an ultrasound machine in, you may not be in the defect, right? So
And this is not like intermuscular shit.
This is like in the tendon. So if you're treating a rotator cuff, you want to make sure the needle is, you want to find a defect, and you want to put especially if someone's paying cash for PRP or bone marrow stem cells or Regenerative, you want to see the actual defect, the tear in the rotator cuff.
It doesn't work.
And you want to put the needle right in that sucker and fill it up. Like, that's the whole point of doing these biologics, is to heal. You don't want to be close enough. That doesn't count, right? Especially for these cash procedures. But anyway, on social media, this guy's just randomly shooting the shoulder. I'm like, that's terrible technique. And I can't believe they're taking people's money and doing this. Same thing with a knee. I've done...
But also putting it on social.
And putting it on social.
So that means you really don't know.
You really don't know what you're doing.
Like when you suck so bad, you feel like that's like you filmed it.
Yeah.
You're like, I think I'm so awesome. I'm gonna throw, and then someone who does know is like, this is dog shit.
Yeah, exactly.
But then obviously, like, he doesn't know. And he's the guy doing it. So the patient surely doesn't fucking know.
Exactly. Yeah, that's
Jesus,
why, like,
dude.
so I mean, I'll probably post just a very nice, polite, respectful, post saying, hey, look, you should always use image guidance. I'll give you an example. I've done probably a couple thousand knee injections in my career. I always use X-ray. I trained with X-ray. That's why I use X-ray. We call it a fluoroscopy. So I put a needle in. I inject a little bit of contrast. I can tell you, maybe about 20% of the time, I get a blobogram. What that means is I put the contrast in, and it just stays right at the tip of the needle. So inside your knee, there's something called Hoffa's fat pad, right? And if you inject the biologics just into the fat pad, you're not going to get spread throughout the joint, around the cartilage, around the ligaments where you need it. Without X-ray, you don't know where you are, right? Or ultrasound. You can do ultrasound too. Ultrasound, you go right above the patella, above the kneecap. There's a space there that it communicates directly with the knee.
Then you can see.
And you can see, exactly. So ultrasound or X-ray. For me, I trained in X-ray. That's why I use X-ray. But about 20% of the time, my staff knows, like, they'll see, like, oh, we're not in. And we'll just advance a little bit further through the fat. I'll put the contrast in, and you see this beautiful spread throughout the joint. And so that's critically important. All these guys who are doing this, orthopedic surgeons, PAs, nurse practitioners who are doing them blind, you don't know 100% where that needle tip is. And if you're injecting in the fat pad or not in the knee itself, and you think you're there but you're not there, people could be going on to get knee replacements that don't need them. If you would have just used image guidance, you would have had a positive response.
Jesus, dude.
Yeah.
That's crazy.
Image guidance, incredibly important. If you're seeing a provider who's just putting a needle in you without ultrasound or with X-ray, I would recommend finding another provider. Yeah.
It's crazy too.
It's accuracy and precision.
If the provider doesn't know, that's, I mean, I guess if they did it without
They shouldn't
knowing,
be doing it.
yeah,
then.
that's what I'm saying. Like,
they shouldn't be doing
it's bad
this.
either way.
Yeah.
Which is fucking nuts.
I mean, you can do trigger points, so you can do shots into the muscle without image guidance because you're not going to mess anything up with biologics. But you got to know which biologics to use. For example, I'll give you this. There are people in the community who are doing PRP, platelet-rich plasma injections into muscles for trigger points, right? What we've learned from a number of studies, this is not new data, but platelet-rich plasma, when injected into a muscle, causes fibrosis. So that's scarring.
Really?
It causes scarring. That's not what you want. Yeah, we've learned from Dr. Bobby Bowers. He's in Atlanta, Georgia at Emory. He treats the Braves. He's presented a lot of data on this. But like for muscle tears, right?
Yep.
If you inject PRP versus platelet-poor plasma, which means no platelets, still from your own blood, platelet-rich plasma causes scarring and fibrosis. Platelet-poor plasma stimulates the muscle cells to grow, divide, and heal. So you want to be doing platelet-poor plasma trigger point injections. There are all these nuances that people out there who are doing this don't understand. And it's about really educating yourself before you do these procedures on people, right?
But, and again, like, I think that's the take too, where it's maybe, I don't know. I feel like, generations ago, like whatever your doctor says, you kind of believe it.
Right.
I don't believe shit anymore.
Yeah.
Which is not the best way to be either. So I'm like, kind of like, well, until you prove me wrong, like I won't believe it. But I'd be more apt to go to somebody who it's their life, where they're just like, I don't want to call them like a psychopath.
Yeah.
But like you, where like this is pretty much all you fucking do all day.
So I tell people there are people who dabble with biologics, and there are those of us who specialize in biologics.
Yeah.
I highly recommend finding someone who specializes in this field. This isn't just an additional modality I provide. This is the bulk and majority of my practice. This is what I believe in. This is what I'm doing. And I started studying this stuff in 2017. I've trained with the world's experts, some of whom now become my really close friends and colleagues. I mean, they're incredible. And it's nice to have those resources. I'm like, hey, what's the newest study out there? Hey, Goyle, check this one out. I'm like, sweet. Now I can take my biologics to the next level. It's not cookie cutter, man. We're in a world of personalized precision medicine and participatory. Those are the 3 Ps. That's the focus of my practice, right? I'm not doing anything to help you heal your body. You're doing it all. You need to be an active participant in your care, right? It's personalized because every single treatment is geared specifically for you. I don't do the same thing ever twice. And I mean, I've done a couple thousand of these over the last 4 years. I haven't repeated the same thing twice in anybody. My nurses will tell you that. My x-ray tech will tell you that. My medical assistant. The syringes change. The concentrations change. What I'm putting in one place versus another. All different for everyone, even in the same person. If I'm doing their knee, they come back for the other knee. I'm going to treat their other knee as a whole separate entity and treat it as it needs to be treated.
Yeah,
so
it's
that's
a different joint. Yeah.
personalized, right? And then precision. Always image guide. Always. You got to use image. You got to see exactly where your needle is at all times. Under ultrasound, you can see the spread. I mean, I'm here for, there's a conference going on in Scottsdale right now that I'm a part of, and one of my buddies, he's a reformed urologist, right? So he practiced robotic urology surgery for the first half of his career, and then he got into men's health, and now he's a big functional medicine men's health guru. But he suffered a little distal biceps tendon tear, and so I treated it on Saturday.
What was he doing, pickleball? I'm fucking with you,
That's
dude.
a good question, man. I don't know if he was doing pickleball, but it's been going on for about 9 months, right?
Yeah.
And so,
well, it's just it's a weird thing to rip. I've not heard many of them.
Yeah, distal biceps. I know it's kind of a weird thing. But image guidance, we could see the tear. Boom, put the needle right there and inject the PRP right there. It's like it's precision.
And I guess so. Insurance doesn't cover any of this for anybody.
They don't, unfortunately. Yeah.
So if someone's going to a normal guy, they're just still paying out of pocket. They're just paying for a shittier product.
Right.
Okay.
Yeah, exactly. And that's why it's not working. That's why a lot of people will come to me like, oh, I had PRP, it didn't work. I'm like not all PRP is created equal. Well, we learned from a landmark study in 2021, Dr. Himanshu Bansal, he and his team, they found the critical dose of platelets needed to treat mild to moderate knee osteoarthritis is 10 billion platelets, right? So we figured this all out. Anything less than that isn't going to do it. That's why some people who are using lower doses of platelets will do a series of 3 or 4 to get to that 10 billion. Okay. So, or you can just do it in one shot. I prefer to do it in one shot. Yeah. Yeah. Just come in once. I'll get the 10 billion platelet dose. I'll inject it, inject some of the surrounding tissues, even the quadriceps if I need to, with platelet poor plasma to stimulate the muscles to get healthier. So it's what we call a functional unit approach. We treat the joint as an organ. It's made up of ligaments, it's made up of potentially tendons and all the muscles, as well as the joint and the cartilage itself, right? We want to treat it all, especially when you have these biologics, because you can inject the biologics into areas that have mild disease and really still improve it, right? But 10 billion was the critical dose of platelets, and that's been reproduced with a number of studies since 2021. And there are still people out there who are doing test tube PRP, which means they take a very, very small sample of blood, spin it, and then inject it, right? If you come to see me, like anyone who's seen me, they're like, whoa, Goyle, you take a lot of blood. But I'm taking what is needed to get to that critical dose of platelets based on your platelet count. That's incredibly important.
So if you had to guess, I mean, it's going to be obviously completely made up, but of all the people who do this type of work, whether it be kind of like I'll give you the umbrella of like stem cell PRP, like what percentage is legit and what percentage is like kind of bullshit? You know what I mean? Like it's like in fitness, there's a lot of really good people who I think give a shit, and there's people who are just doing this until they sell insurance or do real estate or whatever else, which is fine. There's no knock there. But a lot of fitness is fucking horse shit. It just is. At scale, it's shit. The practitioner doesn't care. I don't mean that to say that negatively, but I'm like, the barrier for entry is just so much easier in our space than your space.
Yeah.
So I do feel like most doctors would give a shit. But again, they're all regular people too. At some point, you're in the game for long enough. You're like, I'm tired, dog. I just want to make some money and just kind of, and they mail it in.
Yeah, I think most I like to believe that most physicians
For sure.
who are doing this are doing it
because
they really want to they really want to help people, right? They really want to help people heal, and they're like, look, I need to add biologics to my practice. They may not be doing to a very high level because number one, they don't have the time, or they're just meeting a local representative who has a kit. And they're like, oh, that kit's $50. Oh yeah, okay, great. I can do that. I can do really affordable PRP, even if it doesn't work, right? And there's a lot of people out there doing it. I can't give you a number of
like
percentage.
half.
Oh, I'd say more than half.
Yeah.
Oh yeah, no, because
for people listening, if you're like, hey, I'm in, North Platte, Nebraska.
Yeah.
And I'm not saying your doctor isn't great there. Maybe he is. I'm like, but if it's just like he does it on the side of one of 15 things,
right?
How great it'd be like if I'm, teaching girls, fucking lacrosse. How good can I be?
Yeah.
You know what I'm saying? Like, I run an app, we have a podcast, I run a gym, I have a kid. Like, I can't be good at that thing. And that's kind of how I look at what this is. If it's not your main thing, if it's your sixth thing, how proficient can somebody really be? If it was your seventh thing down the line, you know what I mean?
Yeah, that's a good point. And, that's why for me, this is my specialty. Like, I've dedicated my life to learning this, performing it at a very high level, going to the conferences. I can tell you, so we just had our big Orthobiologic Institute conference in Vegas in August. There's probably 300 people there. And these are 300 people who really want to understand this to a very high level. I had a good friend who was there who's been doing PRP, but he's been just squirting it in there. No, I'm like, dude, you can't do that. And it was eye-opening for him. So I encourage anyone who's in this space or wants to get into this space, go to our national conferences. You're going to meet the world's experts in this stuff because we fly people from, not we, but I feel like it's we because the people
You're part of the circle,
Yeah, but they're my good friends who put these on. But they invite people from all over the world to come and speak and share what they're doing, right? And to create best practices because we all do things a little bit differently. And it's so personalized and individualized. That's why, like, with the research that's being done, there's so much variability. Like, this study will say PRP doesn't work. This says it does work. This says this thing. This says this thing. It's because it's way more nuanced than that, right? There's so many factors that go into play. That's why we have these optimization protocols, anti-inflammatory diets, supplements, physical fitness, movement. If you can do hyperbaric oxygen therapy can be beneficial for some people, not everyone. Some people can't tolerate it. Photobiomodulation, which is like red light therapy, right? Cold plunging, like all these have benefits to increase stem cell production, increase growth factors in our body, and help us heal. But those optimization protocols are critical. When you're doing a randomized controlled study, you can't do that, right? You're taking random people off the street.
Yeah.
Here, we're going to take your blood, spin it, and put it back in here, right? And so those studies are great because you got to do something.
But there's so many factors.
They're flawed.
Yeah.
Exactly. There's always going to be fatal flaws with these studies. This is such an individualized, personalized specialty, right?
Well, and again, I think I'll ask this too, but the takeaway, for anybody is I would try this before cutting into my body.
Yeah.
I've shared this on here a million times when people bear with me. It's the Think Like a Freak book where they talk about gastric bypass and they talk about doing lap bands and all these like surgical procedures, which, judge however you like. The book itself is like, hey, what if you just puked in a jar, wore it around your neck, and every time you're hungry, you smelled it? That sounds fucking crazy, right? Or he's like, or if you gave your lips, I think like 50 paper cuts, you would just eat less. And those all sound fucking bonkers. But if an alien like came down to this planet and they're like, well, you're going to just cut open your body, do this like kind of permanent thing inside of it before trying these other 8 things, that seems crazy to me. So for me to do the things that are less permanent, and there's really like, again, if you're going to like fuck with like a spinal fusion, you're not coming back from that. I don't mean that like you're not coming back. I go, but the mobility in that area is gone.
You're going to be permanently altered.
Forever.
Yes, forever.
And again, if I do a knee replacement, it's now not mine. Like it's something else forever.
Yeah.
And I'm like, why would I not exhaust these options? And then if I have to do then fuck it, I'll do that. Like to me, like the surgery is always the last resort.
Yeah.
It's always there because you can do that anytime.
Exactly.
Which
I agree.
is, but I don't think that's where people's default is.
No, because the system is set up in a certain, our standard of care, cortisone shot for the knee, gel shot for the knee, doesn't work, then get the knee replacement, right? But there's a step in between. I'll even argue and say there's a step before all of that, right? Do the biologics when you're mild to moderate, when it's really not bothersome, right?
But like we don't do
Preventive.
no, we don't do
exactly.
dude, I watch it here. Like we build in everything like so our like how we do our stuff. If you're like here for you're a member here. We build in the mobility to the stuff. You can't fucking escape it because they won't do it before. No offense, everybody, but they won't do it after. I mean, some people will, but we build it in so you can't get out of it. Now, there's only so much we can touch because you could spend 2 hours a day head to toe and you're still not going to be able to do everything, especially as you age, you just pick up wear and tear. Yeah. My point is I'll get people in here. They won't say anything to me about their tennis elbow or golfer's elbow or pickleball bullshit until they can't even like pick up their fucking car keys. And I'm like, it's been hurting you. It just didn't happen in a day. Yep. But they don't say a word until it's catastrophic.
Yep.
That's kind of how everybody does everything.
Exactly.
Where if you could do it, I don't want to say like preventative, but essentially that's what it is. Or when you notice something is, and I think people do this, they frame it like, well, now I'm 45 and this is just how it is.
Exactly. Wear and tear. Well, like I said, what's going to happen when you're 65? You're just going to keep on ignoring it. Then at 65, you're going to have a big problem.
Yeah.
The things you love doing, you can't do anymore. Because you didn't take care of it 20 years ago. Like that's, and so like talking about your clientele, they get whatever's bothering them. I got a friend who's doing jiu-jitsu, injured his shoulder.
It's the, first of all, jiu-jitsu, it's great. You're going to get fucking hurt.
Yeah,
dude.
exactly.
Like,
you are. Yeah.
It's I don't know if it's worth it for most people. And I hate to say that because it's so great, but everybody I know just gets fucked up.
Yeah, they do. Yeah. So he came in with his shoulder messed up. What's nice about catching it early, he didn't let this linger. He's like, man, it's been going on for a couple of weeks.
But he knows you.
But he knows me. He reached out to me. He said, hey, what can we do about this? I'm like, let's hit it with our laser. We did 6 laser sessions. And he's like, dude, this hoodoo voodoo works. His pain's been gone ever since. But if you catch it early enough, it doesn't have to turn into that 4 to 6 week issue to the point where now you can't pick up your car keys. Right?
Well, and it's crazy too, because I mean, I've had a lot of, obviously it's all self-induced nonsense here, but everything has been either fixable by myself or if it's a mix of everything else, whether it's like through our tissue guys and kind of manual therapy and mobility. My back stuff, I did decomp shit and whatever, but none of it's surgery, none of it's whatever. And sometimes you think you have this catastrophic thing and it might just be, basic nerve compression or scar tissue or whatever the issue is, overuse, you name it. It can be fixed, but I do think a lot of people might have something as basic as general wear and tear, overuse injuries, or just general tightness from poor posture, just the thoracic rounding, tight hips, tight quads, all the same shit, which most of the low back stuff, again, when you probably see them, it's not from something other than just sitting on your fucking ass for long periods of time. Yeah. That's fixable. Yep. But yet the normal person defaults, let me just go to the hospital, give me some pain pills or anti-inflammatories or muscle relaxers or whatever, and then here's the surgeon without any mention of, hey, maybe because your hip flexors are so fucking tight, it's pulling the pelvis forward, pushing down on the discs. If we could loosen up the anterior chain, maybe we could get the spine to kind of alleviate the pressure. Yep. But that conversation really never happens.
Yeah, but it's all biomechanics. I mean, luckily in my practice, I've got the time to do that now.
For sure.
So I can examine people. Like I see so my demographic is high school athletes all the way to, I think my oldest patient now is in their 90s.
Oh, you see high school kids too?
I do.
No shit.
Yeah.
Nice.
A lot of people come to me because they're like, we don't want the traditional modalities, right? We don't want steroids in our kid, and we want to avoid surgery. So
what sports? Just general?
General, like gym. I've taken care of gymnasts, basketball players, hockey players, football players. And soccer. Oh shit! Those are the typical the 5 that I probably see more often than anything else.
And obviously, like we're in this micro economy ecosystem here in Scottsdale, which is amazing for so many things. Yeah. But it's not most of America.
Right.
So if someone like they're listening, what would they even look for? Right. Like if it's you, it's you. Obviously, like this helps them know you. But if you're in, Trempealeau, Wisconsin, you're like, where the fuck do I even look? Because there's only the hospital here, the doctor who, does deliveries. He's everything.
Yeah.
Like, where do those guys go?
Yeah, so
Like, search out the internet?
Search the internet. Yeah, do
But fuck, dude,
Google
like,
search for PRP in whatever town you're in.
hopefully it's like, and you know what I'm saying? Like, okay, yeah, this guy does PRP, but it's like,
Are they doing it right?
yeah.
Hard to say. Hard to
Fuck,
say.
dude.
That's where you want to like inquire about their credentials, their training, what have they done, to learn about what they're doing. You can even get into platelet dosing. So if you're doing PRP anywhere out there in the community, all the listeners out there, ask your physician about platelet dosing. So what we've learned over the last 5 years is that platelets, you can consider them like a medication, right? Like let's say you have neck pain, right? And you got Advil, 200 milligrams. You normally take 3 or 4 of those. But let's say,
What's your take on that shit, by the way?
well, I'm not a fan. Like I take Advil maybe once or twice a year. If that, it disrupts your gut flora.
Yeah.
There's a place for like if you're miserable, take some Advil and calm
But
it down.
don't chew 10 a day.
No, and some people are.
Yeah.
It not only wears away the gut lining, increases your risk of
Ibuprofen, all that
bleeding,
stuff, kind of the same.
Exactly. Yeah. Any of the class of medications called NSAIDs, non-steroidal anti-inflammatory drugs. This includes Advil, ibuprofen, Aleve, Celebrex, meloxicam, diclofenac, or Voltaren. That's another really popular one. But when you take these, if you look at the package insert, it tells you not to take them for more than 2 weeks. People are living off this stuff, right? And what it's doing is destroying your internal organ, your stomach, wearing away the lining of your stomach, which can lead to leaky gut, which can lead to a whole host of other issues, chronic inflammation everywhere. And you're taking the drug to try to stop it, but you're creating the problem,
It's crazy.
right? But it also affects your kidneys. We know from more recent data that it increases your risk of heart attack and stroke as well. So those are risks, right?
Yeah.
Especially the longer you take it. I actually saw a client who was prescribed diclofenac twice a day by his primary care specialist, just had a massive heart attack, right?
No shit.
Everything else checked out fine. He worked out, took care of himself, just took two diclofenac every day for the last 7 or 8 years. Yeah, disappeared. He was supposed to come for a follow-up. Oh, yeah, he's in the hospital. Oh,
For 8 years?
8 or 9 years.
Dude,
That's
that
been a long
shit's
time.
bonkers, man.
Yeah, but he's like, oh, I got arthritis pain. That's what I take. He wasn't into the biologics. He wasn't into, he's like, I work out. I don't need physical therapy. So I just take my my diclofenac in the morning and one in the evening. And that was maintaining his pain control. But we think that's what causes heart attack.
Jesus,
So,
dude.
yeah, even the cardiologist is like, oh, so your diclofenac you've been taking for 8 years. Because he had no other risk
But
factor.
dog, 8
Cholesterol
years
was
is so
perfect.
long,
and
dude.
people live off this stuff, though,
Yeah.
right? But,
Well, I think that's I didn't mean to interrupt you.
Oh, no, you're good.
But
Yeah.
I do think that like that becomes a thing where if you're not your own advocate, and that's at the end of the day, I think everybody has to be that. You have to be more educated, and it's hard to do. But with the internet, there is way more information, so you do get stuff. It's just like it's a fire hydrant of shit to kind of follow. But if you're not, you'll get on some of these medications in perpetuity. I mentioned the sleep medications because those are the ones that are notorious where it's like, hey, take this for sleep. The same thing. The packaging is like 2 weeks, dog.
Yeah.
You got people here been taking fucking. What's the other harder sleep
Ambien.
one? Trazodone.
Oh, trazodone. Yeah, trazodone is not quite as dangerous as like Ambien or.
Oh no, Ambien is like
Yeah.
you're like having sex with your neighbor and you don't know it.
Exactly.
Yeah.
When people will sleep drive, they'll
Yeah.
sleep cook, they'll get obsessed with heat. Like they'll crank up the oven 400 degrees and stand in front of it and just like
That's bad.
catatonic. Yeah.
But you'll get people taking that for like a decade
for a long
longer,
time,
forever.
For a long time.
I'm like, that's not normal, dude.
Yeah.
Which is wild.
It's not normal, man. That's why I always recommend seeing a sleep medicine specialist. Like, get to the underlying root cause of your sleep issues. Like, because you can drug yourself, but most people who are taking those medications aren't getting deep REM sleep or deep restful sleep.
No, the quality they have the studies now is dog shit.
It's terrible. So
Jesus.
But getting back to platelet dosing, so let's say whatever small town you said in Wisconsin or whatever, they Google PRP. Ask your physician or the provider if they understand platelet dosing. Like, am I going to get enough platelets to have a response? That's key. Getting back to like Advil, it'll say blood pressure. So let's say a lot of people take metoprolol. That's a very common blood pressure medication. It's a beta blocker. Let's say the starting dose is like 30 milligrams, okay? Let's say this doctor gives you 1 milligram and puts you on it for 6 months and it doesn't change your blood pressure. Does that mean you failed metoprolol? No, it means you were underdosed. PRP, bone marrow stem cells, these biologics work the same way.
Okay.
If you don't have the right dose, you're not going to get a response. And we've learned that. Like, we've learned that there's a critical dose to create a response with these biologics. So you almost treat them like a medication. You got to get the right dose.
That makes sense.
Yeah.
So how do you guys like determine if somebody's like a good candidate versus like they're not? You just kind of look at everything and you're like, yeah, this is something we could potentially fix, or they come in and you're like, yeah, man, your stuff is just smoked.
Yeah. So I just saw a gentleman just a few weeks ago came in. He was all about the biologics. He's like, hey, I found you. It's like, you took care of some of my colleagues and they've done really well. I've got this back issue. It's going into my left leg. I've got weakness there, and I don't want to do surgery. I got a big trip coming up in October. So he came to me. I examined him. He had bad weakness in his left leg, so iliopsoas weakness and quadriceps weakness, and he had a spinal stenosis, huge herniated disc, compressing his nerves. That is not a good biologic candidate, because the biologics. This is really important.
Like he had MRI. And
he was all
herniation was smoked. Yeah.
It was smoke, man.
I've seen some big ones go away, but
but with the weakness though, do you really want to give that 6 months to try to recover that? Because if you don't,
how long was it going on?
It was going on for about 2 months.
Before that.
But it was getting worse, right? And he's like, okay, I'm at the point now where I need to do something. He was doing physical therapy, stellar physical therapist who was like, you need to get an MRI. You need to get an MRI. He's like, no, we're going to get it better. Finally got the MRI, severe stenosis. She's like, you need to see a spine surgeon. It's like, I'm going to go see this guy, Goyle. He keeps people away from surgeons when he can.
Yeah.
He came in to see me. I examined him like, you need to go see a spine surgeon like last week. I was like, because if this doesn't get corrected, you could have permanent leg weakness. We're talking his hip flexor and his quad. And he came in there limping. I'm like, dude, push. Nothing on the left side. Right side, solid, 5 out of 5. That's how we grade the muscle strength. Yeah. This was like 3 at best. And I was like, yeah, buddy. I was like, I'm going to text my surgical colleague right now, see if they can get you in today or tomorrow. And then he got a second opinion from another physician who doesn't do what I do, but sees people before surgery. He's like, yeah, you need surgery.
Yeah.
So those kind of clients, yeah, they're not a candidate for biologics. But the plan is, now that he had a surgery, he's going to go on his trip. When he comes back, we'll do biologics to augment the healing. Because like we were talking about earlier, he had a laminectomy, he had a discectomy. There's going to be micro instability there because no one is addressing the ligaments above and below, the segments above and below. We're going to do a comprehensive functional spinal unit with bone marrow stem cells and PRP, platelet plasma, protein concentrate, all the good stuff, growth factors, exosomes from your own body. I'm going to concentrate all these and strategically place this in areas to augment the healing process, to ideally promote stability and prevent what we call adjacent segment disease, ASD. So when you have a surgery on one part of your spine, you can get disease above and below because of the micro instability that's created, right? We call that adjacent segment disease. We see it very commonly with fusions. When someone gets a fusion, they've lost their motion. Our spine is meant to move.
Yes.
When it's fused, you kind of screw that whole process up. So above and below that level, you can get adjacent segment disease where the degeneration is rapid because those are the segments that are moving now and they become hypermobile. The ligaments get lax, you lose stability, and it just accelerates the disease, and then you end up getting your whole spine fused. So that would be someone who's not a good, back to the
not a candidate up front.
Because of weakness, exactly. But a candidate afterwards, yeah. People who aren't healthy, like I said, smokers. I mean, I've seen a few smokers come through here, and I'm taking care of one who's become she's amazing, but she can't quit smoking. So I'm not doing biologics. It's just a waste of your money. We'll just stick to traditional pain management for you, which she responds well to an epidural shot every now and again. I put a little bit of cortisone. I do a microdose of cortisone. So the standard care is to do whack-a-mole with cortisone, right? You do these 40 milligram doses of whatever medication or
because they want people to feel better.
They want people to feel better, right? But what we've learned is those doses can be harmful. There is something called a physiological dose of steroid where we can use nanogram dosing, 200 nanograms to 400 nanograms. And actually, 200 nanograms to 400 nanograms inside a joint has actually been shown to increase cartilage production. So sometimes with my biologics, I'll combine this nanogram dosing with the biologics to augment healing and repair of tissues. It's pretty incredible.
Yeah.
And we've had this data for 30 years. This is nothing new. But I'll do the same thing in the spine for people who are like, they're like, hey, look, I can't do the biologics, but I'm a smoker. I have pain. So I'll do this physiologic dose. And I'm seeing the same response as I would had I done a full dose. And it's remarkable. Like people are coming back like, hey, my sciatic pain's been gone. It took about 2 weeks to kick in, which is standard for these cortisone types of shots.
Yeah.
Yeah.
And so, like, smoking is really the worst fucking thing ever.
Smoking's terrible. And alcohol's not good for you either, man.
Like, was she just puffing heaters?
Yeah, you know.
Hey,
I think she
fuck.
smokes a pack a day.
Oh, dude.
Yeah, I know.
That's like some old school shit.
I know, old school, right? And there's still people who do that. But you know, I think was it the late great Ozzy Osbourne who was like, I could quit heroin, but I can't quit these damn things.
Yeah.
Right? Yeah, can't quit smoking.
Man. Well, and again, if you know, like, you can get a treatment that would help, I would think, like, it would.
It would motivate you.
Yeah.
Right. Exactly. No, I think the biologics should be really on the list of everyone's treatment plans. Like you should have an algorithm for treatments, and this should be in there somewhere, because I feel that most people are candidates. You know, obviously, if you're like a poorly controlled diabetic, if you're incredibly out of shape, I mean, like I said, you know, and if you're eating like crap in, crap out, that's what, you know,
Yeah.
You're going to give me crap. I don't want crap. Like, that's why the anti-inflammatory diet's important. I've had people come to me and they're like, hey, Goyle, I'm not going to do this pre-procedure protocol. I'm like, I'm not your guy. Go over there and I'm sure someone else will take your money. 100%.
Sure. Yeah.
100%. I'm not the guy. I tell people, like, look, you know, some of these procedures may sound expensive to some people, but it's not life-changing equity for me. What I want are poster boards out there. I want you to cross paths with me, and in 6 months to a year, be like, man, that's the best thing I could have done, and go out there and spread the word that we have these modalities available, and if done right, you can have a profound improvement in your quality of life.
Well, yeah, because otherwise it's like, well, it's like my tattoo guy. If he does a shitty tattoo, it's, like, it's his fucking work, you know.
Exactly.
Like, oh yeah, Kevin did that.
Yeah.
He fucking sucks. But yours is the same way.
Yeah,
They're like, I went to him.
Yeah.
I gave him this money. He did this, you know, PRP treatment, and it was fucking bullshit.
Yeah.
But it's not. I mean, again, like, that's how the body works anyway. I think everybody, like, whether you get antibiotics or something, it's not like they heal your body. Right. It just allows your body to heal.
It augments
itself. Yeah,
exactly.
Like, that's what all these things do.
Yeah.
That's the crazy part. I think sometimes I think like, oh, the doctor is going to fix me. It's like, well, no, they're like, the surgery is correcting a problem, but the body still has to heal itself. Right. Like, that's how it works.
Exactly.
So I guess I'll ask this too. I'll get you out of here in a minute. For people who are listening, like, if it's like ongoing and kind of reoccurring shit, like, what's the first thing they should do before jumping like right to a surgery or like a heavy medication? If they're having like some type of, whether it be like knee, you know, hip, ankle, spine, are you just like, hey, just get an image done and then, you know, like MRI type shit?
Especially if it's been going on for a long time. They've modified their workouts. They've worked with a physical therapist, a chiropractor, and they're not getting what they need. Then definitely get it imaged.
Yeah, like how for me, like, I'm a stubborn guy too. So how long did I wait? I probably went. I can mobility most things away. I mean, but then you until you can't, right?
But then you're probably creating dysfunction somewhere else.
Yeah. Well, it's like, okay, if I do an hour a day of this, I'm like, but again, you're also and I will say this, as much as like I'm not an MRI guy, like I just fucking have a panic attack, like a little bitch in there. I didn't know what it was until I got in there, and I'm like, I'll be fine. Then I'm like, nah, dog, like, you're not.
Me too.
Yeah, you're not fine, bro. Yeah. And if I didn't have this breathing protocol from Dr. Russell Teams, like, I would have hit that little bitch button pretty quick. But the point was, I was doing all the mobility stuff, and mine was more like, okay, I know it's the spine, but I didn't realize it was because the anterior chain was so tight. So I'm not spending enough time. And then once I can see that and have that conversation with the like 2 different doctors I work with, that becomes easier. But I probably waited 2 months. Yeah. And I feel like I wasted 2 months.
Right.
Which, what will you tell people? Like, hey, if you've been eating shit for 30 days, like, that seems like more than enough time to waste.
I would say, 6 to 12 weeks.
Yeah.
6 to 12 weeks, because after 12 weeks, it can turn into something chronic.
For sure.
Right, yeah. But if it's going on, I mean, for me, if it's like longer than 2 weeks, I'm like, all right, I need to probably take a look and see what's going on here.
Especially like depending on what it is and the severity, right? Like,
yeah, and you may not need imaging right away.
No.
But, at least start working towards getting it resolved, right? And maybe ask for help. So reach out to a physical therapist, reach out to a chiropractor, say, hey, look, I've got this thing going on. Modifying my workouts helps, but it's not treating the issue. Let's see if we can treat the issue, right? And that's where like maybe a laser will come into play, or some adjustments will come into play, or all the other modalities. Dry needling, which I'm a big fan of dry needling. That can help too, right? There's all
It'll
these
light you
different
up,
modalities. Yeah. Well, it will.
Yeah, I've had it.
It hurts so good.
Yeah, mine was my left. This is my left one because now it's way better than the right. Like my adductors, like you're in there.
Oh yeah.
Shit's that shit gets you're close to.
Yep.
Yeah, that shit's real. But it does and I say this too. Like and acupuncture is more passive to me. Dry needling is like you're active.
Exactly.
But when I'm
Two
there,
totally different modalities.
yeah, that's more like instant. Like when you hit it, I knew, and I could have done mobility, dude, for 1,000 years and never got that hip that loose. And that's like a 5-minute thing.
Yeah.
And I think that's a lot of things people like. I guess the benefit of being here and doing this, I get to meet everybody and their brother.
Yeah.
So I get access to all this shit that honestly, like I wouldn't have known if I'm just working construction, in the middle of nowhere. Like I kind of got what I got in my circle. Like I wouldn't know about any of the shit you do. I wouldn't even know it's an option. And until today, like I know enough, right? Like I'm the benefit of doing this, but I did know there was shit PRP out there, but I just didn't know how shit it was.
Oh yeah.
You know what I mean?
Yeah.
And I think people sometimes, well, again, anytime you I guess QA on price, you're kind of fucked by what it charges. Because I think there's people who are doing it, hey, get PRP for $50.
Yeah, there's bargain PRP out there, and unfortunately, it's probably not going to work.
Well, it's like getting a hair transplant, like, somewhere where it's super cheap.
I mean, at the end of the day, you get what you pay for, right?
Yeah.
And, to see someone who specializes and is an expert in the field, there's a premium that comes with that, right? I mean, there's a lot of training that goes into it. There's for me, I've got a whole lab built out. I got a class 2 laminar flow hood. So everything's done under strict sterile conditions, aseptic technique. And, a lot of people aren't even doing that. So,
well, and maybe this is not the right way to look at it, but I do think if you work with and I don't say athletes like I think they're of any more importance of anybody else. However, I do think when the doctors work with the athletes, just because everything's money, bro. Mm-hmm. So the amount of money these teams funnel into these fucking guys, if they're sending their athletes to these doctors, you're probably in better hands than someone else, just for the fact of they're not trying to shit out $20 million.
Right.
You know what I'm saying? So if you're getting athletes sent to you, it's okay. Yeah. They do that because they want this guy they've invested money into this guy.
Right. And not only that, the athletes, so I take care of a lot of professional athletes, and so we have the conversation. I was like, look, this little small investment is going to secure your $20 million contract or 40 or $100 million contract. Do you make this in 5 minutes?
Oh, do you ever do the calculator?
Oh man,
it's the most. Even if you make I would just say in the normal world, I make a lot of money, you make a lot of money.
Yeah.
No, I'll watch Barry Bonds has to get 0.001 hits to make what I make in a year.
Right.
You know what I'm saying? When you look at that shit. So for these guys not to
yeah.
invest that in this seems ridiculous.
I took care of a pretty famous relief pitcher, and he was like, this was way back in the beginning of my practice when we were talking about price. He's like, hey man, just so you know, I make $1 million a paycheck every 2 weeks, $1 million. I'm like, oh, okay.
Yeah, isn't that crazy?
I'm like, that's insane. That's a whole different level of
So yeah, dude, you can get any treatment.
I was like, you're good.
Yeah. But I think a normal person who listens, if these athletes, because their body is everything.
Right.
That's their livelihood.
That's why this small investment of just a couple of $1,000 or whatever, they're like, yeah, I want that because I want to heal. I don't want to mask it. I want to make sure I can extend my career so I can keep on making $1 million a paycheck, or for some of them even more than that.
Well, and for me, it's the knock on wood, I don't get hurt. I don't want to be down for any period of time because not only I'm not as productive. Quality of life sucks. There's that. I'm and my body is obviously my business too, but it's no, even if it's not your business, you walk around in this thing every day.
Exactly. It is your business. Everything you do is your body.
Yeah.
It's incredible.
If your back hurts, your life sucks.
Exactly.
If you can't, hike or walk or whatever at a decent clip, your life sucks.
Yeah.
So if someone's listening, what's, I guess the immediate red flags, the weakness and numbness and stuff.
Yeah, weakness and numbness. Something called foot drop. So I've seen people come into me.
Or it's your foot's asleep.
Exactly. Yeah, it's floppy foot.
Oh, they can't even. You can move it though, right?
Well, you can move it, but
it's not like when you rupture your Achilles, it's toast.
It's toast. Yeah. I can't help with that.
Yeah.
Yeah. Maybe after you've gotten it repaired, we can augment with biologics to really help it to ideally prevent it from scarring.
Is that the worst?
Yeah. That's got to be one of the worst.
Rupture Achilles.
Yeah.
That's quad tendon.
Quad tendon too. Yes, I took care of someone who ruptured his quad tendon skateboarding.
No
And
shit.
yeah,
That's
recreational skateboarding and ruptured his quad tendon. That was a long recovery, man. He had significant atrophy. We worked on him for quite a bit, you know.
those two. ACL is probably
ACL is pretty brutal. Now, like partial thickness tears, we're using biologics. We can actually, there's a technique we can do under X-ray to put the needle right into the ACL and deliver high dose bone marrow stem cells directly to the ACL, and we're seeing it repair. It's
no shit.
incredible. Yeah, it's really incredible. You can see this on follow-up MRI studies. So for partial thickness tears, that may be an option for people. If it's full thickness, if the ligament is torn all the way through, like I said, it's not going to magically
No,
but
you're fucked.
you're kind of screwed there. So
Yeah, because I've watched. Yeah, do you know Stacy Barber? Her what's a business? PhysioFix is the business.
oh sure,
She's great
yeah,
on social too.
Yeah, right.
But she filmed hers.
Okay.
Rupture.
Oh wow.
Doing a like she films everything just like we do.
So it happened live. On
Yeah.
her
So like
video,
if I hurt myself, you're probably gonna fucking see it.
Exactly.
Doing a warp wall
Yeah. Oh wow.
in real time, and you can hear it.
man,
It's
yeah.
fucking the worst.
Yeah.
Now, obviously, like she's a gangster, like built it all the way back, and she ran up a warp wall. I think just like a week ago for the first time.
Yeah.
Which is wild. But I'm like, that's the strongest tendon.
Yeah.
And to smoke that, like that's probably that and the quad tendon have to be the worst, probably
Yeah.
too. But I mean, I guess even I think of that, like if I did something, this stuff post would be what I would want to do,
Exactly.
which is beneficial.
Yeah, but for someone like you, Jeremy, you're like, yeah, I can't afford the downtime. That's where the Regenicine
Well, for
program
sure.
comes into play.
Well, I mean, I guess I could like if I couldn't do something for like a week, I'm not gonna be a little bitch about it.
Yeah.
But and again, I'd have to really be smoked too. But I'd rather like just keep it. I'm a fan of just trying to be, just we joke here, like die shredded, man. Like I just want to like
exactly.
I'm gonna get old as fuck, and I'm
Yes.
gonna get like frailer and weaker. Like I'm not under any assumption that I won't. But at that point, I'm like, just give me all the Barry Bonds shit, man.
Yeah,
You know what I mean?
Exactly.
Like,
Well,
why would I not?
we know muscle is the organ of longevity.
Yeah.
We need skeletal muscle mass, especially the older we get, right? So do you want to be a 90-year-old in a wheelchair who people are pushing you around in, or do you want to be the 90-year-old who's going up and down Camelback twice? So I got an 87-year-old guy I take care of. Well, he came to me at 87, and former CEO of a Fortune 500 company. Came to me at 87. He's like, Goyle, hey, listen, I want to be better at 90 than I am at 87. I got some knee pain, hip pain, neck pain, back pain, shoulder pain. He's like, I work out. I'm still running multi-million-dollar businesses, but he's like, my body's starting to fail me. So I put him in a 3-year program. We did bone marrow stem cells, PRP, all that stuff. He did all the adjunctive modalities. At 90, he was going up and down Camelback twice, 3 times a week.
No shit.
At 90, yeah. At 91, last time I saw him, which was maybe 2024, he was benching 200 pounds again. He's like, well, we did it. I'm like, you did it. I just put this stuff where it needs to go.
Yeah.
Yeah, these are simple procedures. Like, you're sedated. Yeah, they're uncomfortable, but I keep you good and comfortable for it. But it's really relatively simple procedures. And then he did all the work.
And he was probably active his whole life.
Oh, active his whole life. Yeah, he's a weightlifter. He was a good 87 when he came to me. I was
sure.
like, dude, you don't need anything. You're in great shape. He's like, I want to be better. So, yeah.
Well, fuck, dude. At that point, I'm like, and I'm not obviously like I have a kid. I'm like, I'm not going to leave him fucking homeless. But I'm also like not going to like work my ass off and leave this kid all this fucking money so he can, you know what I'm saying? Like and I guess that's my point is like, if I could make this better,
Right.
I'm around longer. And even not even that, like I'm just not a salty bitch as I get old because my body hurts and it's broken down. Especially that stuff. Like when you're that old, you're in fucking 90, dude, even if you have the stability alone at that age.
Yeah.
But then to go down Camelback and like, terminal knee extension, like it's crazy,
Amazing.
bro.
Yeah.
That's wild.
Yeah.
Maybe I'll ask these last two. Like realistic expectations for people.
Yeah.
Like when they come in, depending on like what that is. Like I'm sure that becomes a thing too. And I think that's the piece with the surgery when people go in, they're like, and maybe not me, maybe not even people in my age room. I just think older people sometimes, but again, I'm generalizing. I don't know everyone. Hey, I'm going to go get the surgery done and then I'm going to be fixed. And they think that means what it used to be before the pain. Right. And maybe it means reversing the clock 25 years. I don't think that's what happens for most people when they have surgeries, but I think that's the expectation. So when people come to you, like, is there an expectation of what it's going to look like, or do you even walk them through like what that is?
Oh yeah.
Because like if I came in and said, hey man, my knees don't hurt, but they're not the knees I had when I was 25.
Yeah.
They're just not. And they do sound like Rice Krispies. They kind of always have. Usually just tightness, but when they're loose, they're fine. I go, but there's no pain there. But if I came to you and it's like, hey, man, I want to have, joints of a 20-year-old, you're probably like, Jeremy, you're fucking nuts.
That ain't going to happen. No,
Yeah.
that's not happening.
So how do you deal with that part?
But so let's say you did come to me with that same issue. Like what we can do is slow the progression of your degenerative joint disease. So we can at least maintain where you are, maybe even get you better. Because like some of these proteins I inject are anti-inflammatory, so they'll kill the inflammation there. You might notice that, hey, I can do more, I'm stronger, I can push myself harder, and I don't have any knee pain, right? Or it's substantially reduced. Those are my ideal clients, like people who are into prevention, who are like, look, I got mild pain here and there, like I can go play golf and 18 holes, and my back's sore and achy. I got an MRI. A lot of my clients are doing full body MRIs now, and they'll show it to me, and they got some degenerative change. Like, hey, I'm starting to see some degeneration here, some minor aches and pains. That would be an ideal candidate for more of my prevention protocol. It's not going to 100% prevent breakdown of tissues. You can still get injured and hurt yourself.
For sure.
But it can slow the progression of degeneration, right? What we're doing is we're changing the inflammatory environment in the spine and the joint to a more anti-inflammatory state, right? So,
and like, I guess there's really no way to probably know this, but I'm sure some of that is obviously like lifestyle is a 100%. Huge factor.
Yeah.
But then sometimes they're just genetic things.
There are, for sure.
Like where it's like, hey man, like we have a buddy of mine, he basically his knees, I should have him message you at some point. He's in Palm Springs. It's kind of like bone on bone.
Yeah.
Still does a ton of he does all the work outside of it. Has been able to maintain this physique at 43 that most people would never touch at 23. But that's a piece of it. But he's doing all of the things. And I'm like, yes, was once 300 pounds, now looks like Rambo.
Oh, right on.
But also like, you're talking years of, if you looked at my body, like internally, it would look like I got in a car wreck for sure. It's just the amount of like load we've put on it, Deadlifting 600 pounds probably didn't help. Axial loading at the spine, you're talking 300-400 pounds for like how many fucking years, how many reps. Now, luckily, like I don't, knock on wood, have any, like genetically, like that's some type of gift I have.
Exactly.
He doesn't have that.
Right.
You know what I'm saying? So I wonder how much of that is like, sometimes it's just luck of the draw, dude.
It is, yeah. But I believe in epigenetics, and we have the ability to turn our genes on and off through our lifestyle and diet choices. Like you said, he was 300 pounds at one point.
Well, like body type, right? Like if you were, like if you're naturally like ectomorph, mesomorph, endomorph, wherever you rank, and if let's say the scale is 1 to 7, it's not like you're a 7 and a 0.
Right.
And even so, over life, like how you do eat, you can kind of change that mold. You become kind of something a little bit different, I feel.
Yeah.
And that's kind of like what you're saying.
Right.
Like you can kind of move it.
You can. But like you said, diet and lifestyle is the biggest part of it. Sleep hygiene, all of that really, really comes into play.
Well, and it's the duration too, right? Like I always say, like you're always practicing something, no matter what. So like you said, we're sitting here for 2 hours, I'm practicing this posture, whether it's good or bad. Like I try to move a little bit.
Yeah.
When my back was jacked, I would do this podcast like on Eric's pad, like on one knee, and have to stand up because it was just I couldn't sit down.
Man.
I go, but my point, you do sit at your desk for if it's 7-8 hours a day, in kind of this shitty posture where your butt becomes your feet. And a lot of times, like if you look at, I think people look at training that they do and think of, oh, I was working out today and now this is tight. I'm like, it probably wasn't the 10 reps you did of this. It was probably how you slept for 6 hours, what your fight or flight is, how you stress with your phone, how you hold your kid, like all that type of shit. And then you compound that over 20 years, 30 years, or the dental hygienist who leans over and does this all the time. Like, I do think about that stuff a lot.
We call that micro trauma that happens over time. It's that repetitive motion, that poor posture, that constant loading. And what they've done is they've actually been able to take your blood and measure inflammatory markers. So people who have chronic low back pain have elevated levels of interleukin-1 IL-6, which is an inflammatory chemical that's found in our body, and TNF-alpha. So people with chronic low back pain, you draw their blood, you're going to see these elevated levels of inflammatory markers. And now that's what's brewing in the epidural space. That's what's brewing around those discs, and that's what's constantly like, think of it like a smoldering fire, right?
Yeah.
And it's just eating away the tissues there. So
and
that's what's happening. And over the course of decades, sitting, poor posture.
You just make it worse and worse and worse.
Exactly. Yep.
Jesus.
Yeah.
I'll ask these last two. The one, and just because you did the pain stuff for so long, and I'm sure you saw some wild shit, like what's a big, I don't know if it's the biggest, like a misconception you see like with pain medicine from whether it's patients or just providers, or I guess maybe like what patients think it is versus what it really is. Because I know a lot of times people say, well, I have this issue, I'm going to get pain medicine. and it will fix it. I'm like, well, it kind of just masks what's going
Right.
on for a certain amount of time. And I also think, I'm sure most people at this point know, it's not like you take that medicine and it goes to your ankle.
Right.
It's your fucking brain.
It's your brain and spinal cord. Exactly.
Yeah, which I know a lot of people are like, what do you mean? I'm like, well, your brain controls all of this. So is there anything like you hear, you see where people are like, well, I'm on these meds and like this is going to fix me, but it doesn't.
No, I hear that all the time. Yeah, especially my last practice, right? Now I'm seeing people who don't want those things, right? So I consider myself the pain alternative.
Yeah.
So they're seeking me out because they know, hey, Goyle's not going to put us on narcotics, right? But I do believe there's a place and a time for them.
For
You
sure.
know, I mean, let's see.
Like I got my wisdom teeth cut out of my
no
face.
kidding. Right, there you go.
I was, dude, I've been through a lot of, I'm not going to talk about every awful thing on here, but, and I'm not trying to be a little bitch. That was not fun.
Oh, yeah.
Like my face hurt.
Oh, yeah.
Like, hey, drink a protein shake. I'm like, are you fucking kidding me?
Yeah.
This is like, tooth pain is not great.
Tooth pain, and then also, like, I've seen incredibly physically fit grown men come into my practice, like, in debilitating pain from a herniated disc hitting their nerve. And they're like, this is the worst thing I've ever experienced in my entire life. You know what? You may need some pain medication to at least sleep, right? To calm that down, that sympathetic tone, right? Because you're never going to get into that healing state.
Oh, no, you're, because I couldn't, mine was 3, L4, L3, L4, L4, L5. No. Yeah, L3, L4, L4, L5. And then L5S1, I had a unroofing there, but I had 2 herniations above it. And I could barely put my underwear on.
Yeah.
Like that would be the hardest, but that was the hardest part. Bending over.
Yeah, right.
Like when you're kind of like
discogenic pain,
and then I'm like, then I could like, if I stood up, I could be fine.
Yeah.
But sitting down and bending over was like, there's this point of no return where I'm like, God, this fucking blows, dude. And I would wish that on nobody.
Right. Exactly.
Like my wife had been like, you're a miserable fucking prick to live with. It's just like, your life does suck, dude.
But what's important to know is like those medicines aren't solving a problem. They're just controlling.
To get you through.
To get you through, exactly. You got to do the work, the physical therapy, the rehab, all of that stuff matters, right? Because it's a mechanical issue, right? A lot of what I see is a mechanical issue. It's your body failing it, you know, at a certain area because of biomechanics or trauma. And so we got to fix that with biomechanics and physical therapy and physical movement.
Do you still think there's like an overprescription of those or no? Not compared to like the Wild West days.
Yeah. I mean, you know, so like I trained at Cleveland Clinic, man. I mean, I remember in the first few days of my fellowship, you know, I saw a woman, she had a pain level of 4. I
out
walk
of
out
10?
Out of 10. Sorry, 4 out of 10. Yeah, 10 being worse.
4 out of 100.
Yeah,
Motherfucker, dude.
4 out of 10. And so I walk out. I'm presenting to my attending at the time, saying, "Okay, this is what the case is. Okay, what do you want to do?" I'm like, "Oh, physical therapy, this." And they're like, "Oh, well, first line treatment for 4 out of 10 pain is OxyContin," because at the time it was. I mean, that was
straight up.
That was standard of care.
What
that
was
standard
the,
of care in 2005, 2006. Like,
what was the dosing of that shit? Because I remember, what was that documentary?
Dope Sick.
Is that the one with Matthew Broderick? No. He does one that it's like the Sackler family.
Oh yeah, that was the other one.
Same one. It's
Dope Sick was Michael Keaton.
Maybe Painkiller.
Yeah,
Painkiller was that one.
Yeah, right.
But they would
They're
do
both great.
like the highest dose of oxy. They call them like oxy coffins, basically.
Yeah, right.
Yeah, I forget. Like it was a pretty high dosage for those.
Yeah.
Like what would those guys get? Like what's the starter dose?
You usually start with I think 10 was the lowest dose when I was practicing. I think they might have created a 5, but 10 was the lowest dose. But it went all the way up to 80.
So, like, what is 10, though? You're, like, high as fuck. I never did oxys.
No, I mean, it just depends on who you are and, you know, the amount of pain you're in, you know. 'Cause most people tolerated it well. But the problem was it's a potentially addictive substance.
And then you have to
rewiring your physiology. You become physically dependent upon it because we need endorphins to survive. This drug replaces the endorphins, so your body says, "Oh, I don't need to make endorphins anymore."
Like if you take testosterone, it'll shut off your body's own production.
There you go. Yeah, same phenomenon there. Yeah, exactly. But like for the first 10 years of my career, people were surviving on it, they were living on it, and it was doing something for them, right?
But you have to do more as time goes on.
Potentially, right? There were some people who were stable on their doses. You know, maybe 10 milligrams once a day or whatever, or 5 milligrams twice a day. Whatever pain medication it was, and it just maintained them. Other people, forever, for whatever it was, chronically, like a lot of people I saw back then were people who were in traumatic injuries, like really bad car accidents.
It's chronic pain.
It's chronic pain.
Like it's no matter what, they're just on it.
Yeah.
And what if you stop taking it?
You go through withdrawal. Because there's a finite amount of time, about 72 hours, maybe 3 to 5 days before your receptors reset and your body starts making endorphins again. And so those first few days can be pretty horrible.
So what do they like titrate off if they do come out? Are they
Yeah,
supposed
usually we
to?
titrate. Yeah, use slow titration. Yeah, I mean, I haven't prescribed narcotics in so long now.
Yeah.
I have a couple people. Well, after my procedures, I give people the option. I'm like, hey, look, I'm going to do all these shots. You may need some pain medication. I'll send it in for you if you need it.
Yeah.
Yeah, 95% of people usually don't. Like, I just took Tylenol and it was fine.
Yeah.
Yeah. But
Interesting. Yeah, because I wonder like if you're on like the highest dose of shit, and it's
Yeah.
like, yeah, I'm just gonna stop taking it.
no, you can't do that.
Yeah.
It's a bad idea.
Then you're fucked
Yeah,
up.
bad idea.
Yeah.
Yeah, a really bad idea. You'll learn it real fast. Like once you miss that first dose, you're gonna be screaming for the second dose.
Yeah.
Yeah. You're gonna. Yeah.
Yeah, because it has changed a lot. I do feel like that space
It has. I mean, I'm not in it anymore, so I don't know what the prescribing habits are. All I know is in 2023 that one of our business consultants was like, to get yourself out of this hole that you've dug. Because what was happening, like I said, back to the original story that we're getting into, is I was running an insurance-based practice, but delivering concierge level service. So I was spending half hour with people, like really connecting with them, trying not to make them feel like they were rushed in a mill of any sort, but what I didn't realize is that insurance is terrible and they're not going to reimburse me, so hundreds of thousands of dollars of my own money, I was paying for other people's care, not getting reimbursed for it. And then, that drove me into a pretty bad situation. But in 2023, like when this business consultant came in, they were like, listen, that's what was going on in 2023. Like, this is the model for pain management to be successful, because insurance companies will reimburse for that urine screen. They're not going to reimburse me for the procedures I do. They may or may not reimburse me for the office visits, but they'll reimburse for the urine screen, which is crazy.
It's so nuts.
So I don't know what the connection is there or how that works. Maybe because a lot of these insurance companies have pharmacy benefits manager, and so they're making money off the medications we're prescribing. So they're like incentivized to, pay for the urine cup because they're making more money off the prescriptions. Who knows? But anyway, yeah. That was the climate in 2023. I have no idea what it's like now because I'm so far from that world.
It's unfortunate too, just because like and again, I don't run an insurance company, I don't run a hospital, but we do have like the CFOs here of hospitals, and so I get the ins and outs of. It's a business; they have to make money, and like when you look at like I had a kid, obviously, I think their bill was like 40 G's. That's that's fucking bonkers, bro. Now I'm not saying I could do it on my own. I can't do that. Again, you have an anesthesiologist, you have this whole team of people. I go, but a normal person is going to go in and have a kid for 40 G's. They would bankrupt them for 1,000 years.
For sure.
I go, but if you don't have insurance, I'm sure it's not the same price. It's a different thing. And I go, that's the hard part, is where if you want the best care, sadly now for a lot of things, the insurance, even if you have it, it doesn't matter.
Yeah.
Like, because we have great insurance. But there's not a lot of things I can go get done that I want done because the insurance doesn't cover it.
Right.
Which is crazy.
Yeah.
So you have to seek
exactly
what you would call alternative medicine, but it's not.
It's really not.
It should be the beginning.
Exactly.
And the end, or at least part of, but again, a primary care hospital, it's not in their toolbox to refer to you unless they know you personally.
Unless they're a concierge medical phishician. I mean, that's who refers to me primarily. People, because I've got that network of people. Because they're like, we know if we refer to Goyle, I'm going to be an extension of their concierge medical practice, right? So their clients are just going to seamlessly walk into another concierge practice and get that elevated level of service, right? But in order to provide that, I had to step out of insurance. There's no way to sustain that in an insurance-based model.
No, and even just, I guess for people listening, like if you can have access to a physician and talk to them, like text them and call them and shit. And I'm not saying there is an insurance place, guys. Like at Mayo, they're good on the portal. Like if you get a good team, like I got some people there that are fucking awesome. If I'm like, hey, what book were you talking about yesterday? And I'll send it in the portal. They reply back within a day, which is great. But a lot of places don't have that. And they don't get that. And you see your doctor, dude. Once a year, or I guess what I'm saying to people is, I'm not telling you what to do. I don't know what to do. But if I was going to get someone to cut me open or put a bunch of shit in me, I'd want to have met them more than once, or at least know something about them, or know that they kind of know my name. You know what I'm saying?
Exactly.
And I can maybe reach out to them, or if because if something didn't go right, or maybe it wasn't working, I don't have to pray that they reply to me within 5 weeks or 6 weeks or 7 weeks or 8 weeks. You know what I'm saying? Because I think that's very common.
Oh yeah, no, and like I said, I take care of people from all over the world, right? And so my out of country people, WhatsApp; my out of state people, cell phone. I think 2 people I took care of this week were from out of state, and so they got my cell phone. They're flying back. They flew back yesterday.
So do you like the telehealth kind of virtual shit if you have to?
Just usually text.
Yeah.
Look, if we need to do FaceTime, I'll do FaceTime.
Just hit me up.
But yeah, a lot of these are executives and people this like their second home here, and they just fly back and forth. So I'm like, hey, when you're back in 3 months, pop in. I'll take a look at you. We'll just follow up in the office.
So, and I'll get you out of here. The last, like, how do these guys, if someone wanted to work with you, how does that, what does that look like? And what should they bring? Like, what questions should they ask up front? Or like, and what to kind of expect? 'Cause I think that's the big thing where, like, for me, I'm sure people fucking hate me. I'll show up with like a whole printout, dude.
Yeah.
And I know my doctor's like, you're nuts, dog. But here's first of all, here's the blood test I want to run.
Yeah.
Like, cause this is the shit I just want to know because I'm a nerd. I go, but here's how I've been feeling. Here's what I look like. Here's what I'm looking to get out of this.
I tell people the more information you can provide me, the better. So how it typically starts is you call our office, 480-660-8823. That's our office line, and ask to set up a discovery call. And so then one of my concierge care coordinators will do a discovery call, and they'll just answer all your questions. Yeah, and then based on that call, they'll determine if it's worth sitting down and doing a consult with me or not. Because I can't fix everything, right?
For sure.
And so there are ideal candidates and there are non-ideal candidates.
So you just kind of like, you
It's a
pre-qual.
little triage. Yeah, it's a little like a triage.
Like
Like a pre-qual, yeah.
Rupture my Achilles. You're fucked.
You kind of need to go see a surgeon for that and get it fixed. Come back and see me when you're healed.
That makes sense.
We can do some things for that, right? But like I had like someone from Boston called and on behalf of their mother who's not doing well. And, in that kind of a situation, like I got a good buddy in Boston who's a phenomenal regenerative medicine specialist. I was like, well, instead of flying all the way here or doing a consult, I'll just send it to this guy. He's one of the top experts in the world.
And that's awesome too.
Yeah, so I've got a network of incredible people all over the country. Some people it all comes down to this. I tell people, if it's not my hands that heal you, let me be a resource for you.
For sure.
Right? And that's how this works. I believe in connection. Like the people who cross my path were meant to be together. We're meant to go through this together, right? And if I'm not the guy for you, let me help you get to the right person because there's a lot of shysters out there. There's a lot of dabblers. Like I said, there's those of us who specialize in this field. And there's those who dabble in this field. Let me help you get to a specialist, okay? Because these are people I trust. They're world leaders. They're doing the research. They're at the conferences I attend. They're my friends, and I know the high level work they're doing. So it's incredibly important.
And I would say for people, if you listen, like these things are the things for me. Like I would say, always just do a consult or at least the first discovery call with anybody before making these. I don't want to say catastrophic's probably not the right word, but just these more. They're like permanent type decisions with your joints. For sure. And, dude, your fucking spine, man, just because I know, like, that shit is as bonkers, dude. Or before, it's like, I would like to not replace anything if possible. I would like to keep it all the original parts if we can.
We're young enough, you and I are, that we're fortunate we have these tools, barring any major trauma or anything.
For sure.
We have these tools available to us now. Like I said, I've done 4 biologic treatments in my left knee. Last one was over 2.5 years ago. I'm 100% pain-free in that knee. I can squat, I can climb, I can run, do all the things I want to do. But I also put it in my healthy knee just to preserve the cartilage.
Oh, no shit.
I do, yeah.
And now do they feel they're like the same?
Feel the same.
It's weird because like there's sometimes where I'll have, and sometimes injuries are like that, or I mean not the catastrophic ones. I haven't had them, but when you have like minor shit go on, sometimes because you have to do more, I don't want to say management, but it's basically what it is, like a better mobility routine. Right. You got to take care of the joint better. Maybe like your pre-workout training is a little bit different. You become better because of it.
Right.
Like I know way more from getting hurt than just being a savage.
Absolutely.
Like, and I can talk to people a lot better because I'm like, oh yeah, I did that same dumb shit. I've had tennis elbow. Yeah. Like I've had where I couldn't lift my fucking arm over my head. Like, yeah, I know what you're going through. Yeah. That is helpful.
Yeah. So discovery call is the best way.
Yep.
Right. 480-660-8823 or our website, www.ispwscottsdale.com.
I'll put all this stuff in the show notes. You guys have social media too?
Yeah, we do. Dr. Ashu Goyle, DrAshu Goyle. Instagram is probably our most recognized platform.
Yeah, I'll pump all this in the show notes. Right. But it's all great stuff, dude. It's crazy, like the stuff that you can do now.
It's amazing. And this is nothing new. Like I said, like Peter Veiling has been doing the Regenerative program since the late 90s. Philippe Hernigu has been doing bone marrow aspirate concentrate in the knees since 1983. So,
but I feel like it's for people who are not in the space or connected to it, it does sound like a fucking like you're a wizard or something. You know what I mean? And it's just
Well, I do get mad scientists with this stuff.
yeah,
I do.
because
Yeah.
we're not used to it. We're used to just like this is how it was, and this is kind of how medicine works. And I do, and that's the part I try to do these with people like you guys, just because I do think it's important. And we get locked in these boxes of like, my insurance pays for this. This is what I do. This is what I have to do. And I'm like, there's a whole other world out there, which it doesn't. For me, this is not how my brain frames it, but I know like if I describe it to people who tend to be, and I'm sure younger people too, they tend to be older. They look at it as like, this is kind of like out there shit.
Right.
You know what I mean?
Yeah,
like
sure.
For some reason, they don't trust it enough yet. They'll trust these, and I'm not trying to knock the pharmaceutical companies, but like, what diseases have a lot of these things really fucking cured? You know what I'm saying?
Yeah.
And yet we'll trust these guys and we'll trust this team over here, but not these guys because this is kind of out there. But I'm like, the results. I've just seen so many good things of like me not having surgeries and getting things like whether it be like manual therapies and different peptides and different things. Like you can, like, dude, I'm 42.
Yeah.
Like, it's not against my dad. This motherfucker wasn't me at 42. You know what I mean? Like, I'd beat his ass, dude.
Right.
Like, so,
Right
and because you take care of yourself and you do these things. And so it is out there for people.
Exactly, it is. Yeah, and it's a choice, and it's about getting educated and just being aware of all your options. Like that's the most important part.
And I think the one thing I probably took away is even if you do have a surgery, because you have to, whether it be full tear, rupture, whether it be disc shit, you name it, to do this post, I think is great too.
100%.
To help help it actually heal, and not just like the issue itself, but about, like we always say too, most of the joint pain too, honestly, and you probably know this, it's for our people that's not catastrophic, it's above or below.
Exactly.
It's they have something going on above or below the joint, which is causing the joint pain to happen.
You got it.
Like your tennis elbow typically is not the elbow itself.
Shoulder, hand, wrist, and that's where a comprehensive approach comes into play. Like I can treat the anatomical issue, but I need my team of personal trainers, physical fitness experts, and physical therapists and chiropractors to work on the biomechanics of the entire unit, right? The whole kinetic chain.
Oh yeah, and you can take the time, which
Exactly.
most people can't.
Right.
I take it, bro.
Right on.
We good? My T-shirt is this is the Bob's. This is Corporate Assessment Service. It's 1999. It's Office Space, dude. It's the shit.
Love it.
I'll put all your social stuff in the show notes.
Thanks, man.
It's been money, bro. I appreciate
likewise. Thanks for the opportunity.
Everybody else, all the other stuff's in the show notes. You guys can pick it up if you're on Apple Podcast. Drop it a 5-star, leave a comment. Same thing, Spotify. Drop it a 5-star, leave a comment there. If you guys want free samples of anything, obviously hit me up. Otherwise, give these guys a follow on social. I'll put all their stuff in the show notes, full website, everything else. Anything else, reach out. I'm sure he'll hit you back, give you an answer to any questions you guys have. Until next time, eat well, train hard, be nice to people, and please, you guys, keep doing shit you love with people you enjoy because your life is too short not to. I'll talk to you soon. Peace.